Welcome back, Dr. Donald.
Thanks for having me, Maya. How you doing?
I'm good. How are you?
Doing well. Hanging in there. Just had a baby girl 2 weeks and 6 days ago. So
Nice.
everything's going well. Mom's good, and yeah,
Dr. Erin, she's doing good.
she's doing really well. Doing really well.
The baby sleeps through the night.
About 4 hours max. So that's pretty good right now. We're kind of hanging in there. Right now, the days have been a little difficult, so trying to work through that, set up a good schedule in the day, so then she's just more tired at night. So working through that. Sorry, real quick, I just can't hear anything.
Oh, you can't hear it?
Nah.
Okay. Hold on then.
Okay. So congratulations on your daughter.
Thank you so much.
She's beautiful.
Thank you. Thank
She's-
you. Takes after her mom.
Dr. Erin is very beautiful,
Oh, yeah.
and she's
100%.
very smart.
Yes.
She's smart as a whip.
Oh, yeah.
You probably figured that out real fast.
Day one. Exactly. And Nasira's picking up right where mom, left off. She's very intelligent, already, passing certain milestones she shouldn't be at for, weeks. So, bless. She's awesome.
You know what? You're going to have to start explaining things to her the way they are earlier. I told you so.
Yeah,
That's not going to work for too long with someone that smart.
I know. And I've been talking to mom about it, too, because I'm a believer in that, too. And Aaron is, too. But we're trying to navigate, okay, Nasira needs to be a kid for a certain period. And then how early do we do that? I don't know. It sucks we have to have these combos, especially considering the times and, who she is and everything. But we want her to have her identity. We want to shape that, help her to shape what she wants to be, what she wants to become. And in the process of that, saying, don't let this happen to you. Don't listen to that person. Don't do that. So I think we're just going to do it as it comes.
Yeah. I got her that book.
You got a book?
I got her that book. You remember
one?
that book we sent?
Which one? I forgot.
Don't Get Molested or
Oh.
something. The Don't Get Molested baby book.
Can I tell you this?
Yeah.
And this isn't pandering. This is 100% honest. When Erin got the book, she was like, "Oh my God, it's my favorite book. Mine's awesome. I love her. I'm definitely reading this to her."
Don't Get
Because
Molested.
I was reading through all the books and I saw it. I'm like, "What? Don't get molested? Who said that?" Oh my! And then Erin just lit up like, "This is awesome."
Because it's on you. At the
Yeah.
end of the day, it's on you to not get molested. Because people are going to try, especially if you're a girl.
Oh yeah,
They're going to be trying until you're 40.
yeah.
You got
There's
to
a
be
lot of creepers out there. Sucks, man. But yeah, you're right. You got to let them know earlier.
Mm-hmm.
So we're still trying to see how we're gonna do that.
Yeah, no, she'll be smart. She'll be fine.
Yeah.
You just got to know.
Oh, yeah.
I will give you a candy bar. Daddy will give you a candy bar. You don't have to take anybody else's candy bar.
Exactly. I will give you rides. You don't need to go in the vans. I have you. You
Mm-hmm.
do not have to do this.
Yeah. Yeah. Oh, that's funny. You got the food kit too?
Yep.
Okay, good.
Thank you so much.
Of course.
Oh
I
my
just want to make
gosh.
sure.
Yeah, it was very thoughtful of you and Tony. We appreciate it.
That's what we care about is don't get molested and eat good.
Oh yeah.
That's what matters in life.
That's it. And sleep. That's about it. Those
Yeah.
are the 3 things. Yeah.
Yeah, she's going to have to. She'll start sleeping,
Yeah, we're working on it. She's getting better day by day, so we'll keep working on it.
So when she wakes up after 4 hours, how long is she awake for?
So as soon as she wakes up, we feed her. And if it's at night, we put her right back to sleep, maybe rock her for a little bit. And then she usually goes to sleep. And during the day, she's been prayers up to Erin because she's been feeding every 2 hours, maybe at the least. And so trying to help work through that. When I come home, it's mostly my fault, I'm going to be honest. Because when I come home, I want to play with my daughter. But it's around her bedtime, so I'm keeping her up a little bit during the day. So I'm trying to dial it back right now. As far as when I come home, I want to love you, kiss you, hug you, but I can't do it for too long. I'm sorry, you got to sleep. So just working on that.
Yeah, soon, and you'll have them 2 more weeks off soon too.
Yep.
So it'll all work out.
Yeah.
That's a shame. You have to go back to work so fast.
Yeah, but I mean, this is the life I chose, unfortunately. So, well, fortunately, I'm not gonna say unfortunately because I love my job, love my patients. But yeah, sacrifice.
And they need you.
Yeah.
They need you at the institute.
Oh yeah, it was the sweetest thing ever. They my unit psychologist and my staff told all the patients about the baby, and they made a big poster, probably half the size of this wall, with pictures, and they all Said, congrats, you're going to be the best dad. Signed their names. Of course, I'm not going to display it anywhere, HIPAA. But it was the sweetest gesture ever. It was awesome. And then when I came back, like, it was just like a party, and it was great. It was awesome.
Yeah. Hey, it's about that time. Everyone's going to start having kids soon, so.
Yeah. It's a big boom, man. Huge boom. Everyone I know is, like, getting pregnant.
They're paying you to get pregnant now.
Yeah.
They're giving you extra money to get pregnant.
Yeah, it's ridiculous.
Which makes me think, what do y'all know about the demographics? Because why are you paying people to get pregnant?
You're right. You're right.
Because China, they went from 1 child to 2 children to like almost immediately, okay, 3 kids now. I'm like, so no one's having the 2 children. You want a few more people to have the 3 children, but that's okay. They must know something we don't know. Their projections are like, we need to pay them money.
Uh-oh. Yeah. Who knows?
Who knows? I don't know if it's going to convince me just yet, because I'm like, how much money per
How many
kid?
do you want?
I want 3 to 4, because we were 4. And then the 2 boys, 2 girls. The boys can play with the boys, girls can play with the girls, share rooms, very simple, close in age. But that's chaotic.
Yeah.
4 is chaotic.
What about 3?
3, I feel if there was 3, there would be like 1 that's just like extra.
Yeah.
Does that make sense?
It's going to, I think the extra one's probably going to be the youngest, but the youngest is going to probably latch onto you and Tony. So the other 2, the middle one will probably be more independent. The older one will probably pretend to be the parent or be the parent-like role. So I wouldn't say independent, like rebellious, the middle, and then the youngest is going to be your best friend.
Yeah. All right. I'll do it. I think I'll be a good mom, but I don't know how much patience I'm gonna have for the whole baby thing. I see people having babies and then the children take over their lives. Like the children dictate things, and I'm like, oh no, I'm not listening to someone who hasn't graduated high school yet. Like,
because trust and believe, like if it wasn't this whole ass pandemic out here, like Nasira would be everywhere with us. Like, we would take her everywhere. That's how my parents were with me. When I was born, like, they took me everywhere. And, you got to see a lot of things, see a lot of people, different people. As a kid, you're learning so much. And just seeing all these new places, perspectives, it's confusing. But, I believe it helps development.
Oh,
seeing
yeah.
different scenes.
Yeah, it's just I just remember going with my mom places, and whatever she was doing, we were doing.
Mm-hmm.
I guess there was a library because she went back to school when we were really, really young, back to graduate school. Then we sat down and read a book, and it was the college library. You found a college book and you read, and you were quiet so that she could do her work. And then it was like you were helping around the house, like you contributed to the house and made the house run better, not worse.
Yeah.
So. I'll see what kind of a mom I'll be. I hope they don't hate me.
You think you're going to be strict?
Yeah. Because
Okay.
I'm strict. We're strict with ourselves. Why wouldn't we be strict with the children?
True. Like on some, like, what was that movie? The dad had the whistle and they were, like, singing and stuff. The musical. It's like a famous musical.
What? When did it come out?
The Lady in the Field, Sound of Music.
Oh, it's Sound of Music. Oh.
Weren't they really disciplined in that?
Well, yeah. There was a lot of discipline going around back then. I guess they need to be like on it if we ever need to like run over the mountains and escape the Nazis. That's just super severe.
I was just thinking about the times in the home, but yeah, I
Well,
forgot
that was the
Nazi
thing,
Germany.
yeah.
Yeah, I forgot.
They had to like escape, and yeah, that was some real stuff. I guess you could prepare your kids to be like, when you grow up, some real stuff might go down, but they might be like, survivalists. Then it might mess them up. So.
Yeah. Oh, another good movie. You seen Captain Fantastic?
Mm-mm.
Have you heard about it?
Mm-mm.
So it's a movie about it's Viggo Mortensen is the main character, and he has 4 kids. They live in the woods, away from civilization, their whole lives, and his wife dies. And they're kind of raised as survivalists, but at the same time, they're brilliant. And the rest of the movie was like the kids like trying to go against everything that they've been taught to like live in civilization, and the dad being resistant to that. But when they go into civilization, yeah, they're like socially inept in some way, but like the lessons that dad and mom taught were like amazing. It's a really good movie. It's on Netflix.
I'll check it out.
Yeah.
No, I will check that out. You know, that's the rub because you send them in civilization, and civilization's a little broken right now.
Mhm.
A lot of the kids that they're going to meet are going to end up with drug habits. Like, not to be like that, but it's just,
Yeah.
you know, what do you do once they turn like 13?
I don't know. And especially where we live, you know, legalization of a lot of things. I predict in the future more drugs will be legalized. When regulated and monitored, I think is something that's good. But when unregulated and unmonitored, it can be potentially dangerous. So we're going to have kids potentially in this environment. So exposing them early with us and kind of helping them to process everything is better than not knowing what's going on and just trying it and then hiding it from you.
Yeah. Well, I remember when we were young, this was just after DARE.
Mm-hmm.
And they were like, all drugs are bad. But then once kids realize that marijuana isn't so bad, then they don't believe you on heroin and crack either.
Yep.
So you have to tell them exactly the truth. Like, beer is whatever, hard liquor, maybe you want to hold off on that until you're 25.
Mm-hmm.
Like they do, you know, in Europe, you know, beer and wine, whatever. And then weed is whatever. Don't go near heroin. For any reason whatsoever, don't go near heroin.
Yeah.
But you have to, you can't say all drugs are bad because they're going to see through that and they're going to think you're lying.
Exactly. And especially DARE taught us that marijuana is the gateway one. Like, it's the worst of the worst because it leads to everything else. And it's like, no, it's not. It's not at all.
Where's the evidence for that?
Yeah.
Like,
Propaganda.
it is because it was illegal. And so if you're willing to do one illegal thing, you're probably more likely to do other illegal things.
Yeah.
But it wasn't it's not a gateway. It's certainly not. And beer would be more of a gateway, or cigarettes.
Exactly.
Cigarettes that's the one they start when they're like 8 years old. I remember some bad kids around us, you know, they started on cigarettes when they were young, and then it moved to beer, and then
it can lead to like a lot of brain damage, inattention, irritability, aggressiveness, all these things that, you know, a lot of people talk about nicotine withdrawal or nicotine intoxication, but like it's like the most habit forming drug out of all the drugs, nicotine.
Mm-hmm.
Not talking about it. They have a whole big lobbyist industry and everything else. So of course, you know, they made it on this side and they're talking about drugs bad on that side, just like alcohol. I'd argue they're all equally bad, besides marijuana.
Besides marijuana.
And psychedelics. Stuff like that.
Psychedelics. Yeah. The nicotine, I wonder, is that dangerous in and of itself, or is it because it's smoked?
Because you can chew it and everything else, so it's equally bad.
Is it?
I just think my personal belief is nicotine is just so addictive. It's just addicted and habit forming, and then with that comes the negative effects of nicotine. So simply because of that, I'd say it's fairly dangerous. My opinion, doing it too much.
You know, Tony has
Because
a
it directly
nicotine.
leads to cancer. I mean,
The nicotine itself leads to cancer?
like smoking.
Smoking. But the toothpicks that Tony has,
Oh yeah, I remember
those are all nicotine.
Yeah.
Yeah.
I don't know. I haven't done research into those things, but I remember those cool. It was like cinnamon or something.
It's cinnamon, and it's supposed to give you like a little buzz. It does make you a little bit more alert.
Yeah.
But the thing was, he would chew them up, and then the dog would get them because he would throw them in the trash.
Oh.
And I think the dog was... Can dogs get addicted to nicotine?
Anyone probably could. I don't know. Probably. I would say yes.
Well, we had to put it in the big trash with the lid because he was going through and he was getting the nicotine toothpicks.
So he was deliberately going for them?
Yeah, he was chewing them up, and then we'd find him and be like,
yeah.
what is
He's
going on
addicted.
here?
Yeah. Nicotine, man. You made Doyle
He's a little tiny
a little
dog.
cigarette addict. So whenever someone smokes outside, it's just like jumping up, wagging his tail.
Well, I don't know if he knew what it was, because he was just like,
Mhm.
oh, this smells like Tony, you know? And Tony's there, probably a full-on nicotine addict by this point, because he goes through a pack a day. Hey, that's interesting.
Yeah. It's possible. I don't know. I haven't researched, so I can't really comment on it, but I just know about nicotine.
It's supposed to be a hack. Those toothpicks are supposed to be like a mind hack to make you think a little bit faster.
You think it's like a placenta? It's a placenta.
Placebo, because you're on baby mode. You're a baby
I know. I was
mode.
like, what? Even when I said, I'm like, what? Placebo?
Yeah, I don't think it's placebo because I've taken the toothpicks and I'm like, well, this is different. It's
Yeah.
like having a little bit too much coffee.
Mm-hmm.
It kind of gets you like here, and it kind of gets you like
Kind of jittery.
a little
'Cause
bit.
even caffeine is kind of like amphetamines, essentially. They're all like in the same family, just a little bit different chemical structure. Caffeine, amphetamines, meth, all those things, cocaine, they're all in the same families. Stimulants.
It's just what we came to talk about today
Oh,
is methamphetamines.
okay, good segue.
Yeah. Okay, I drink a pot of coffee a day, but I'm still better than all the meth heads out here, right?
No.
No? Yes?
I mean, I'm not a coffee drinker or tea or anything like that. I mean, in moderation with everything and in small doses. If you said a pot of coffee a day,
A French press.
okay. So it's a little about that big.
It's 3 cups.
Okay. I would just try to cut down, my personal opinion. Just too much of anything is bad for you. Too much water is bad. But specifically with caffeine, just increasing your risk of like high blood pressure and just like increasing like the vasoconstriction in your body, and then just it being habit forming. Anything that forms a habit, I really kind of advise it against. That could be anything, video games, whatever, anything.
That's interesting.
I know I'm addicted to video games, so I'm speaking from personal experience.
Exercise forms a habit.
True. And
That's
it can
good.
lead to disorders like body dysmorphia, stuff like that.
Oh, come
It could.
on.
It
Come
could.
on. Don't
It
give me
could.
that. Don't
Anorexia,
give me that.
bulimia, it could.
I did this whole video about the
could.
Diet Coach app
Mm-hmm.
that they tried to make less problematic. They took my app away and
Yeah.
they made it like sanitized it. And I was like, give me my problematic app back.
What does the app do?
It's supposed to. It used to have a little avatar,
Mm-hmm.
and it would show you how you're looking, and you could dress your avatar, and it would tell you if you ate too much, and it would give you reminders of, hey, go exercise and stuff like this. And everyone was like, oh, this app is problematic, blah blah blah. And then they took it away, but everybody who liked the problematic stuff, they were like, hey, where's our app? You
Yeah.
know. But
So, I mean, you're probably in the category where you don't kind of fulfill the criteria of one of those disorders, but in the wrong hands, it can be kind of enabling, or, you know, your desired goal is 100 pounds. You know, today you're 130 and you look like this. You should exercise for, I'm simplifying the app. I have no idea what the app
Yeah.
does, but someone like that, I would be cautious. But in controlled hands such as yours, I wish you had your app back.
it wouldn't let you log more than 3 workout sessions a day.
Oh,
It was like,
That's
you
interesting.
worked out 3 times. That's enough. You can work out more, but you're not going to get any more points for it. So it would let you log it for the calories, but it wouldn't give you points towards your goal.
so do you get points or goals for the appearance part of it too? Like you said, like, oh, you put your avatar on how you look.
You could pick your avatar.
Okay, but like as far as how you look, are they like commenting on like your body fat or anything like that?
No, they wouldn't say anything bad. They would just have your goals, and sometimes there would be glitches, and it would show you like Fat Maya avatar. And I'm like, I was never Fat Maya avatar. I just thought it was funny.
Mm-hmm.
Well, that's because I'm a different type of person. You know, there's more sensitive people, and then there's less sensitive people.
Okay.
So I think for the less sensitive people, it was a problem because they do get addicted to exercise, and they do get addicted to cutting calories.
Mm-hmm.
But for less sensitive people, they're just like, hey, let's have fun, you know?
Yeah, I agree.
So you're telling me I can't have coffee, I can't have my app, I shouldn't exercise so much.
You can have it. This is America. You can have whatever you want. This is
you.
America.
It's America.
I'm just as a physician, it's my job to just say this is what I recommend. I need to heed my own advice a lot of times, but just knowing what these things could do and what they could potentially lead to, just warnings. But if you're good and you're cool, you're monitoring it, go nuts.
So I know you study abnormal people, abnormal psychology. So abnormal.
Yeah, quotes, but yeah.
Yeah. So how many people do you think take it too far with the coffee, with the exercise, with these things, nicotine?
As far as how many, I mean, a lot of Americans do. I would probably say even less if I had to say it, because a lot of people are home. They're not doing the commutes. They're not doing all the early morning grind, you know, either unemployed or they're working from home. So I would say the consumption's gone down compared to pre-COVID. But if COVID wasn't here, yeah, a lot of people would consume. I would say overconsume. Starbucks was like so profitable, and all these other coffee chain places are like every block now. When we were kids, like,
That's
they weren't that
milkshakes.
prevalent.
Half of those people are leaving Starbucks with milkshakes, which I'm not going to judge because I like my sugar too. But come on,
There's a lot of frappuccinos. There's a lot of all the other stuff because I don't drink coffee. So there's a lot of this other stuff. Some people are using milkshakes or drinking milkshakes, but a lot of people now, let me get the double shot of so-and-so. It's in 7-Eleven, double shot, espresso,
I'm
cold,
not gonna.
ice brew,
Yeah, okay,
frappe.
the ice brew.
Just
Yeah.
throwing out words. I don't know what any of that means.
I like the taste of coffee. And here's the thing: is that when we were little, they used to give us coffee milk in school.
Mm-hmm.
So we got
Coffee milk?
yeah,
Like creamer or coffee milk?
like you know, have chocolate milk and
Yeah.
strawberry milk. We had coffee milk.
Ugh.
When
What?
we were like little kids.
Where was this?
This is in Rhode Island. And I didn't realize that outside of Rhode Island, kids don't get coffee milk.
I've never heard of that before.
Yeah, we get coffee milk.
Oh my gosh.
Because you got to stay awake. You got to do your work.
That's
This isn't a game.
You're just giving caffeine to kids? How old are you when this started?
From like elementary school. So
What?
from like kindergarten on, we had coffee milk.
Can I Google this real quick?
Yeah, look it up. Autocrat coffee milk. And you can get the syrup so you can put it on your ice cream. It's just like chocolate syrup, except it's coffee.
What? Coffee syrup?
Yeah,
That sounds... And that was good to you?
it's delicious.
I don't know about that. Do you have like a coffee lobbyist as a superintendent?
This is only a Rhode Island thing. It's only a Rhode Island and Southern Mass thing because you got to be within
I've never seen this before in my life or heard about this.
coffee.
Coffee time? Like something
Coffee.
like that?
We like the autocrap of
Really?
coffee time.
Have you heard of this before?
You put it in your milk. You put it on your ice cream.
I ain't never heard of that.
So you have more coffee. You give it to the children.
Is this what? It's like a big gallon of syrup?
Yeah,
that
it's a big
just
gallon. Give it to the
And
kids.
you put it in the milk? Or is it like you
Yeah.
drink it like that? Like
you put it in the milk, like it's chocolate syrup, like Hershey syrup. It got a little bit of caffeine in it.
I've seen pictures like that. What?
Yeah. See, they love each other.
Well, I can't really knock it because I've never tried it, but it just sounds disgusting. I'm sorry.
This is the land of Dunkin'. I think Dunkin'. There's like a Dunkin' lobby with the schools, and
Yeah.
they're like, get these kids addicted to coffee as soon as possible.
Get the donuts. Put the donuts next to the coffee milk.
No, and
We'll
then
tag team them.
if you get a Dunkin', the Dunkin' way,
Mhm.
it's like a bunch of cream and a bunch of sugar. That's what I used to get. I don't drink it like that anymore. But it's basically coffee milk. It's the same thing.
Oh,
So if you get,
That's true.
give me a Dunkin' coffee, the Dunkin' way, they'll give it to you as a coffee milk.
so they hook you young.
Mm-hmm.
Oh my gosh. I'm sorry. I never heard of that. I've never heard of that.
Oh, that's.
Is
try
it anywhere besides Rhode Island?
No.
Okay.
And Rhode Island is the smallest state.
Yeah.
So leaving Rhode Island, I was like, so where's the coffee milk? Where's the autocrat? And people were like, what are you talking about?
The autocrat. I'm sorry. That's funny.
Hey,
Hey, you
it's-
can corner the coffee milk market out here if you brought it back.
yeah. You know what? I know these kids out here.
You don't want to give them more coffee?
Well, they're just going to be at their computer. They're not even running around.
True.
So I wouldn't I wouldn't mess with anybody's child out here. Like, I don't know
Yeah.
how they raise them. I don't mess with anybody else's kid.
Because the thing is, a lot of the solutions are here. You live in California. Please go to a beach. Please go on hikes. Please exercise. Here's all these outlets. Here's all these options of things you can do. Blah, blah, blah. And medications, obviously. But yeah, it's liberal. We have the tools out here. I don't know. I just wouldn't do coffee, like you said, to kids.
I looking back, I would not give elementary school kids a bunch of coffee at lunch because then their parents are like, how am I supposed to get these kids to sleep?
Yeah. And don't you have you didn't have nap time in elementary?
No.
Well, not elementary. I meant kindergarten.
Oh, yeah, kindergarten. We
Okay.
have that time.
Did you have coffee milk in kindergarten?
I don't remember.
Okay.
But I was in Attleboro, Massachusetts for
Okay.
kindergarten, so they might not have done that. And that's just over the border, though, so I'm not really sure.
Gotcha.
Wait, so how close is coffee to amphetamines?
Well, they both contain neurotransmitter norepinephrine, noradrenaline, and that's controlled of like your fight or flight response. So they both help with that stimulation, attention, alertness, hyperarousal, stuff like that. Things that coffee does. But meth, what it does, basically, it releases a lot of those neurotransmitters. So norepinephrine, serotonin, and dopamine. Dopamine's your mood hormone. Serotonin's your mood hormone. Dopamine's like your pleasure hormone, and then epinephrine, what I just talked about. It gets released, but it also, at higher doses, blocks the reuptake of the synapses where it gets released. So basically, cocaine, if I were to compare cocaine and meth, cocaine releases blocks the reuptake of these neurotransmitters, the same ones. Meth releases and blocks. So cocaine works. It gives an effect for a short amount of time. Meth lasts longer because you're releasing it and you're blocking the reuptake. So it stays in the middle and stays having its effect. Does that make sense?
No, it does make sense. Okay.
So cocaine, it's not in charge of pushing anything out. It basically blocks the doors. Whenever you're releasing neurotransmitters, they come in like things called vesicles. So it releases norepinephrine, dopamine, and serotonin. And then the vesicles come back into the thing that it's released. When I'm saying the thing, I'm talking about the nerves. So it gets specifically the presynaptive area gets released into the synapse. And then it has an effect at the postsynapse, the next nerve. So cocaine just blocks the door, doesn't allow those vesicles to come in, and it just leaves these neurotransmitters to do their thing. Meth pushes them out and closes the door. So not only does it stimulate these effects that we're talking about, but it also blocks the reuptake, meaning it has a longer effect compared to cocaine that just blocks the door. So cocaine in theory is more potent, but meth just has a longer lasting effect.
Because when I see people do cocaine, they seem okay. Does that make sense?
Yeah. So, like, because it's so short acting, it works. It has that immediate effect, like, oh, this feels good. I have all these, I'm feeling good. I'm euphoric. I'm having pleasure, so I want to do pleasurable activities. A lot of people do sex with it. I said do sex. Have sex on it. Do pleasurable things, and I have all this energy, so I'm going to keep doing it for a while. And then after a few hours, it kind of goes away. Whereas meth, you have the same effects, but then it's like, okay, this has been going on for a number of hours, and okay, it's lasting longer, so I need to take more to have the desired effect that cocaine has. So not only are you having the damages potentially of doing meth chronically, but since it's so less potent compared to cocaine, you need more of it to have that cocaine effect.
And so how does crack cocaine compare to powder cocaine?
It's just the way it's like made. So like crack has like baking soda and other elements in it compared to cocaine, which is just pure from the specific cacao plant. So they both are the same, but just crack is more like, to say stepped on, more diluted. But it's the same thing.
It acts on the body the same way.
Same way. So like the only difference is, where it was distributed and punishments associated with those things. And that's a whole nother topic.
Yeah.
It's the same thing.
If it's the same, it's the same.
Yeah. Same thing, heroin, opiate crisis. Also another topic, sorry.
That's messy. There was, we'll handle this on another day, but there's a really good documentary on HBO about how they did that and how they orchestrated that. Like, it's definitely a conspiracy.
Yeah.
What they did, like in the late 90s to get the public addicted to cocaine, I cannot believe that's legal. And they made like music videos of themselves like dancing around talking about how they're going to get everyone addicted to Oxycontin.
Oh, wow.
Yeah. Oh, it's so messed up. It's funny, but it's like all these upper middle class white people are conspiring to get everybody on these pills.
Yeah.
I don't know, funny, haha. It's like a different kind of funny. It's like funny, wow, that blew up in our face kind of funny.
Yeah.
Anyway, check that out on HBO.
Okay. I'll check it out. I think I know what you're talking about. I just don't know the name of it.
It's like a crime documentary, but nobody paid for any crimes, so.
Of course.
Yeah. Yeah, so this started because I sent you a video of a lady who's on methamphetamines.
Yeah.
And if you're in LA, you can't not see people on methamphetamines because they're just on the corner like doing their dance, tweakers.
Yeah.
Why are they tweaking?
So it's a combination of things. So energy, pleasure, euphoria. So when you're on meth, you have like this high amount of energy, so you feel like you have to get it out in some way. Yeah. It makes you feel euphoric. So if you're in a dysphoric situation, I would do meth if I was in a situation of a lot of people who are homeless out here without the support and don't want to feel this way, feeling down, depressed, things like that. So combination of all those things and the fact that they're tweaking, part of that could be some kind of like high energetic psychosis or mania because meth is associated with the development of these disorders. And so, because when you're having these things, that's why our medications are anti-dopamine or blocking those things. So in order to control the psychosis or the mania, things like that. So the tweaking is just like disorganized behavior, possibly responding to internal stimuli, meaning like delusional thoughts or hallucinations. And so that's just a reflection of that.
And the meth causes the hallucinations?
If it just depends. So certain people, just like they're susceptible to certain things, it goes down to a multitude of things, your genetics, your trauma history, whatever. So if you're intoxicated with meth, some people can do one hit of meth and then it's like, yeah, they're psychotic. Some people can do multiple hits. When I say hits, like smoking or injecting an IV, whatever. They can do multiple hits and then they'd be fine. So it just depends on that person. So when you're acutely intoxicated and you're also susceptible, then it can lead to mania. Then it can lead to psychosis until the drug washes out of your system. And then you can, quote unquote, go back to normal. But some people, they pass like a threshold and then it's like you're just stuck. And now the disorder that you were genetically predisposed to having, such as schizophrenia, bipolar anxiety, whatever, is now here to stay without kind of being suppressed.
And they can't dial it back from there?
Can't dial it back in some people.
Because I sent you a video. What's her name? I'm skipping around here. This lady was called Juliana.
Yep. It kind of looked like Linda Blair, kind of from like The Exorcist.
With the hair?
Mm-hmm.
Yeah, she
like
was.
The scratches and stuff like that.
Yeah, I'll play a little clip of Juliana so that people can see what she was going on. She was just
sad. Yeah.
And
but the thing is, it's sad to us, and probably to her, she experiences sadness and all these other emotions, but in that moment, she's probably somewhat euphoric too, which is like she describes things in certain ways, and she's kind of like in her own world, and that's the disturbing part of it. It's like you're not really seeing where you are in that situation. Just the fact that you're so detached from reality and you're just living in this mode sucks, but in a weird way, it's comforting to that person. But it does suck. So
if you were to get Juliana, if they were to bring Juliana into you, what would you say to her?
So what I would say is I would get a view of her world. I want to know the intricacies of it. I want to know why she's here because I'm an inpatient psychiatrist. So usually, not usually, the people that show up in my facility, they're under the criteria of grave disability, meaning you're unable to provide food, clothing, or shelter for yourself due to your mental illness. So that's the reason you would be with me. So if she's at that state, I would get an idea of her world, and then I would ask about those things. Hey, so what do you do on a daily basis? How do you support yourself financially? How do you eat? Where do you normally sleep? Do you have like different clothes? Do you ever take shots? Like where? I want to know all these things, and if she's unable to tell me with collateral history from people that support her or like people that worked with her, then I would make a determination like, okay, this is really bad. She believes that this is this. Let's work on fixing this way of thinking. And a lot of that is medication, but some of that is almost like trying to challenge the delusions and help her kind of navigate this path. Just to say like, oh, that doesn't make sense. Let me think of it a different way. And then hopefully that helps to flip that mindset. Could
someone like her potentially live on her own again?
Yeah, definitely.
Really?
Yeah, I think so. The fact is, I think in that video she was saying like how she self-medicates, and usually whenever I hear self-medication, I think substance use, drugs. A lot of meth users say I use meth to feel better, to be okay, and it's actually obviously making the problem worse, but to them, it makes them feel better. It makes them feel pleasurable. It makes them feel energetic. That's better to me if I was in that situation. So I get it, but they just don't have the insight to know that, okay, let's dial it back. Maybe this was possibly the cause of this problem. Let's get a temporal story as far as this whole thing. Oh, so there's all these things you're talking about, these voices that have been bothering you, this figure from who's real in your past but now haunting you on a daily basis through these delusional thoughts. Let's talk about that. Oh, that started like about a year after you started doing this. Oh, do you think it's possibly? So it's about doing that. And the way you do it, you develop that alliance, talk to them, kind of like how I'm talking to you. Just keep it very simple and just hopefully navigate through their world, know their world, so you can help them in it.
Okay. So we'll come back. Yeah. We'll come back to that because we see them a lot, and just visually, it's hard for me to tell the difference between a meth head and a crack head on the street. Are they are they much different?
No, there's not a major difference. You really couldn't tell. One of my old attendings that I trained at USC in downtown LA, one of my old attendings kind of had a theory that when I saw it a few times, it was true. And nothing proven, no studies, anything. But if someone came in to the ER and they were like acutely psychotic or disorganized or manic or something like that, he would say, ask them what they want as far as food or drink. Usually if they're hungry, it's usually cocaine. If they're thirsty, it's usually meth. And it actually goes to the mechanism of action and what both do. Cocaine actually does cause appetite suppression, more so than meth, which actually causes severe dry mouth, severe dehydration. So that kind of has been helpful, and I've seen it anecdotally be true, but that's not always the case. If I were to see someone on the street, you couldn't really tell because you don't know the amount, you don't know how long, you don't know if that's organic mental illness compared to drugs, because a lot of people just assume it's drugs, but it's not always the case. So you can tell the difference as far as if someone is on drugs compared to like organic mental illness in some cases. Because a true schizophrenic doesn't want to engage you. A true schizophrenic might like, yeah, can I have some assistance? Maybe, but they might be paranoid of you. They might not want to be around other people, so they're not going to be engaging you. They're not going to be, unless you intrude their personal space, where someone on drugs might be more engaging to chase that high, to get funds or other things. Not 100% true, but if I had to use something in my mind, I would think that before talking to the person. Then when I talk to the person, then I would say, okay, this is how it is.
That's really interesting. Probably about 10 years ago, one of my gay friends told me that him and his, this is not for just gay people. This is everyone who, you know, has a fun lifestyle before quarantine. You know, they're enjoying their lives. But that meth was like a party drug.
Yeah.
Because, I'm watching some Soft White Underbelly, and they're like, yeah, we do meth so we can have sex forever. And that's, I guess, what they did at these parties. And I was like, meth, that seems like a really hard drug for that. But I guess people just use it sometimes.
Yeah, it can be because of the euphoria properties and just the increased sexual, like increased libido it can cause. It just makes you horny specifically, and it actually makes you able to last in your mind longer. In actuality, that's not really true because it causes vasoconstriction. So
don't do meth.
Yeah, I would say don't do meth.
Don't do meth for this purpose. Don't do meth in general.
No. Yeah, never. Yeah, I would not recommend meth. It's very habit forming, very addicting. I would recommend no. Please don't do meth. The ramifications of it are huge. Don't. It's not worth it.
And Ritalin and Adderall, those are...
So Ritalin and Adderall are amphetamine salts, so they're analogous to meth. Meth just has a different chemical structure, so they act in the same ways. But the thing is, meth, you need higher doses to have the same effect as like an amphetamine. And it's what I mean by that, because it's longer acting compared to like a stimulant, like Ritalin, Adderall, things like that. So, and when they're doing it, when they're giving out the doses, it's a lower amount than what it would be potentially in like cocaine, things like that. Cocaine's more potent than Ritalin, things like that.
Because I remember in high school, college, kids would do Adderall to stay up and do papers. Yeah. It's common. I don't know if they still do it.
Oh, yeah. So,
I mean, and then you get the hallucinations because if you're up for 2 days, just the sleeplessness will give you hallucinations.
Yeah, it can. Yeah. That's why, like, sleep is so important. I always talk to my patients every single day about sleep. We always focus on sleep. If you're not sleeping, nothing's going to work. Nothing I can do, nothing you do, got to sleep.
That's absolutely true. Okay. I was watching a podcast. Oh, let's do this one first. Okay. So do the drugs cause the mental illness or mentally ill people self-medicating?
Person dependent.
Okay.
Some conditions lead to some of the symptoms are increase in pleasurable activities or indiscretionary behavior, meaning doing things without thinking, very impulsive. So what I'm referring to is like more bipolar, specifically the manic part of bipolar disorder. Some people use it because it calms them down. It helps them to focus, so ADHD. Some people use it in order to feel better, depression. Some people use it for more energy, depression. Some people use it to potentially kind of take their mind away from the current situation because of the euphoria property, and that could be any disorder. But it can make a lot of those things worse. And also on the flip side, of someone predisposed to mental illness and having, I'm sorry, not predisposed to mental illness, but they're just using drugs recreationally, that's why I say the moderation thing is key, because I don't know. If you use it and I don't know anything about you, I'm going to ask like, okay, did you use drugs? I always ask everyone, do they drugs? Yes. Okay, cool. I see you for a few days. Drugs have had the adequate time to wash out. I'm talking to you now. You're 1,000% better. Okay, it was the drugs. Here's my little spiel. Unfortunately, this drug led to these symptoms in you. I would just be careful because unfortunately now you're predisposed to this, and the more times you use it, the more you're increasing the risk of developing this condition you have now, and it's staying. So be careful because your brain doesn't have a lot of plasticity, meaning flexibility. Once it develops, it kind of stays where it is. So when you're using drugs at a younger age, you really want to be careful that you're not messing with the development, because then you just impede that development, and then you'll never be able to get to your fullest potential. So when you said 25, that's the average age that your brain fully develops. So I would just be careful in those people who have used it and have shown symptoms, and then once the drug is gone, they're back to normal. I would just say watch out, because the next one could be the one because of this and this situation you're in. But any other people, if they're just using and it's not affecting them, I would still give them the same spiel and say, like, just be careful. You're just increasing your risk. It hasn't affected you, your family history, you have nothing, no history of this, and no other factors that could potentially bring it on. But just be careful. Any person, I would just say just be careful. Moderation.
I saw one soft white underbelly where the guy says that it started with Ritalin when he was a kid. And now he's a meth head, and he's in his 20s. Are you seeing that, or is that...
I'm definitely seeing that. And part of that, I'm going to say, is the medical community's fault, just like the opiate crisis, because they might have not had a psychiatrist who was properly monitoring his Ritalin intake, informing the parents or the person about when to take it and when to take drug holidays, because you have to take drug holidays with Ritalin, meaning times you don't need to focus, because Ritalin affects your growth. It affects, again, irritability, things that come with like the caffeine type side effects and just always being on it, fight or flight. So weekends, don't take it. Unless your kid's in summer school, don't take it. Days off, don't take it. Only when you need to focus. So that's what they probably should have gotten that education. Maybe they were overdoing it, and then it just led to more things. Or the doctor wasn't monitoring it. Symptoms came up. Here's your prescription. See you next week.
And
that
now
was
he's
happening
a meth
too.
Addict.
I'm sorry?
Now he's a meth addict.
Yeah,
He's
because it does the
26
same
anyway.
thing. It's analogous. So it's like he is somewhat treating himself, but now it's gotten to this point, and it sucks.
So that Ritalin was like the coffee milk for him.
Yeah.
That's scary.
Yeah. But it can be. It's all about risk. Everything's risk. Not saying it will happen, but this is what it does. This is what it could do. This is what it did in you, because I want to personalize it. I would just listen to that. That's it. Make your own choice.
If anyone's watching and they have a doctor that prescribes their kid Ritalin or Adderall, would you get a second opinion, or what? How would you say? How would they?
So some of the tests are reliable. One of the tests we used to do, and we still do, is like you have to have like a checklist. So basically, you're asking about the symptoms of ADHD, which is hyperactivity, impulsiveness, and inattention. And you need 6 out of 11 of these different symptoms. There's a lot of them. So you give a checklist to family at home, and then pre-COVID, you gave a checklist to your teacher. Because part of the diagnosis is you have to exhibit these symptoms in more than one setting, different settings. Could just be disorganization at home. If there's chaos at home, but there's order at school, how you expect the kid to react? So that's why they do it 2 different settings. But COVID, it's going to be even harder now. So a lot of people are in one setting. So they're kind of adjusting testing based on that. But there's also some computer testing. My sister is a child and adolescent psychiatrist who specializes in ADHD. And she does virtual work with ADHD. So a lot of her things are computer programs, computer tests that she gives. And they're very sensitive and different types of like games you kind of play. But it's like very sensitive, meaning ruling out that you don't have the disorder.
That's very scary.
Yeah.
Because I know a lot of kids I used to go to school with were on, one of these hyperactivity drugs. So to think that that could have an effect later down the line.
Yeah.
Because they didn't have a choice.
Yeah, and even now, like, the way kids are being taught, well, if we go back in the lockdown, the way kids will be taught. You have to sit in a room, look at a screen for, 8 hours a day? Like, that's impossible. I couldn't even do that.
No. With editing, you know, I got a few hours in, and then I got to do my PE at home, like, you know, the home workout.
Yeah.
They better have these kids running around.
Please. They have to.
Because otherwise, they're not even going to develop the muscles. They're gonna be flabby when they get older because they never had, especially once you hit like 12, you really do have to start exercising.
Yeah. And I'm a firm believer. I mean, power to kids who are homeschooled. I'm not against homeschool at all, especially if you have some kind of social outlet with it. But you need that. That's part of development. You need the social aspect just as much as you need the educational aspect. Being around other kids, learning yourself through other people who look like you and talk like you. Like, that's the way to develop your identity and your ego. So I think it's detrimental to just not have that, in my opinion.
So kids should go back to school, regardless of what's happening right now.
I think kids need to be safe. I think everything needs to be safe.
But
For their development, they need to go back. For the times, let's wait it out, because this is really damaging. Kids are becoming carriers and bringing this stuff back home to elderly mom, dad, who's more susceptible. And even though the kids aren't symptomatic, that's what we're seeing in some cases, not all cases. So
yeah,
I don't know. I really can't answer either way.
I think if elderly mom and dad should probably, if they're elderly or if they have pre-existing conditions, I don't want to say anybody has to do anything, should probably be jabbed.
Yeah.
Because you have to send your kid out into the world.
Yeah, you have to.
You kind of have to. Like, we don't know what these kids are going to be like in 20 years.
Oh my gosh. That's what scares me.
I mean, can they have a conversation face to face? Can they look a person in the eye? Can they date? Are they going to be able to have kids and have a relationship? I don't know.
But think about us in 20 years. How do you think we're going to respond to kids like that, too? You think we'll have the patience to know, like, because we're kind of a unique generation who's kind of been through the technological age and then the way things were age. So it seems like we're a good bridge between that. But as far as these kids, like, the social, like, ineptitude that they might have, I don't know how I would deal with that as an elderly person.
I was joking around with my gay friend today. This is one of my many gay friends. I was joking around because he was saying that he has like this from being on his phone over COVID this whole time. And I was like, that's why I'm not afraid of any of these young girls trying to come take my man, because they're all hunchbacks. And like, what are you going to do? You're going to take my man as a hunchback? You can't even have a conversation. So I'm not worried about it. I'm like, yo, these kids coming up today, that's actually kind of sad. I was just joking with him because we're completely insensitive.
Yeah.
We're so insensitive to everybody else. But it's true. Like, everybody looks like this, and they're messing up this part of their back where they don't have the...
And it comes tight. It's like a source of like anxiety, stress, and it's just like, ugh.
You got to get that. First off, you got to do the actual stretches to unlock that upper part of your back. But sometimes you have to go and you have to have that released, because if you're like this all the time, especially in front of a computer for 12 hours a day, and that's how your back forms as a kid. I don't know what these kids are gonna do.
Excuse me. Yeah, I don't know.
I send them to yoga, because that's a, what do they call it? They're talking about lines in the neck where these younger kids are having, like, they look like they have older necks because they're always like this the whole time.
Oh.
Yeah. It's just talk online. But it's true. It's not even just being antisocial, but they're physically going to look different than we look.
Yeah. And part of that, what it's really going to do, and this is why I talk to Aaron about this all the time, like, empathy and perspective are just going to plummet in the day-to-day person. The only way you can become truly empathic is if you like been around people to know their experiences who look different than you and kind of get their perspective of that situation. That's going to go away unless you actively seek it out, because of the way things are kind of marketed now. You're in a bubble whether you like it or not. Things are directed to you and what you like, so it's hard to kind of step out of that, especially when you can't literally step out of your house. So it's like going to be a bunch of bubbles kind of clashing.
Yeah, I don't know. But for me, I think that the sports, you got to get them into team sports. Yep. Even if there is a increased risk of them catching something, if that's a problem for the family, everybody, who's concerned should be jabbed if they're concerned about that. But I think it's so important kids do sports.
Agreed.
And deal with kids and learn how to lose and learn how to win.
Exactly. Told Aaron, I was talking to Aaron about this too. Yeah, something.
Something. I don't know if sports are on the rise or not, or are on the decline. I know homeschool's on the rise.
Yeah.
Which is another thing that's like, okay, let's see where this goes.
Yeah. Oh no.
We might have, in about 20 years, might be a generation of serious weirdos. And it's not even their fault. It's like during their formative years, they were just locked in the house.
Yeah. And locked in situations, I mean, where, you know, you might not have known where the next meal comes from. You might have been in an abusive place, and school's your only escape, and all those stories that we know happen. And that's going to affect the way you concentrate, learn. What's the teacher going to do, like, in that situation? They can't, like, you know.
No. The teachers
sad,
now,
yeah.
How are they supposed to deal with kids on, how does this even work? Why don't, a kid could just mute their thing and be playing a video game, like.
Exactly.
How do you, it was hard enough when we were kids and the teacher had to control a classroom, but I don't know what they're doing right now, honestly.
And then as a parent, it's like, yeah, here's your school, but let me bring up this other window with this game on the same, like on split screen, so it looks like I'm doing work, and just all the technology kids have.
Kids are too smart.
Yeah.
Kids are too smart. It's really, for certain subjects are much harder than others. Like certain subjects you need to pay attention to. Mm-hmm. Like English, okay, we all speak English. You can probably read. You can probably get by on that. But like maths and stuff like that, mathematics.
If you fuck up on math early, you're done.
You're done. You
need to know that. Yeah, you're done.
Yeah. Because you miss a year, and then the next year you're like, I'm lost.
Yeah.
I don't know what this is.
It's like the only subject that just kept building and building. Like you couldn't miss an episode of math. You had to do every single one. It just kept building.
Yeah.
All the way.
All the way, and that's where the money is.
Yeah.
And the STEM.
Yeah.
I mean, you got to learn how to use computers, but yeah, that's really scary. I'm glad I'm not any younger than I am. I'm glad I'm not even a year younger than I am. Because I think about it, I'm like, oh, as soon as I got free, everything just went crazy.
Yeah.
Just society went crazy. And I don't know if I could have dealt with their
Even
pressures.
now, like, I'm glad I graduated med school when I did. I did all that. Like, the doctors that are being made now, like, they're going to find a way to bounce back. I'm not talking trash about any doctors who are in training right now. But in the times of COVID, you literally all hands on deck were COVID. Oh, you learned about all these other diseases, these disorders. Surgeons, you'll work on other things. We need you here. ER people, you're going to see other conditions still, but you're going to be in that wing and you'll work on it one day a week. But the other days, you're going to be here, the COVID wing. So it's like you're diverting a lot of attention to a couple of disorders. Or for med students, a lot of places, they don't have a lot of sites that they can go to. I know some hospital systems with the medical schools are saying if they're on a COVID unit, we really don't want you there, especially toward the beginning, because we don't want to increase your risk of doing that. I know my site has done that a couple times with the med school. So students might not even, their only psychiatric experience, they're not able to go to the hospital to see. So it's a lot of virtual learning with that. And imagine your psychiatrist or your internal medicine doctor, you have a psychiatric issue because 4 out of 5 people who need mental health treatment actually get treated by the primary care doctor. So imagine that doctor not seeing a psychiatric patient on an inpatient unit or whatever, their rotation. They come to you. They're probably going to look up some things too because they don't know. You haven't had that experience. So that might come down the line with some other doctors. But I'm just guessing, but just from the fact of what's out there and what we've had to treat and what we had to like kind of alter our treatment to do during these times.
Well, to be fair, I think what's beating out COVID and cause of death now is like cancer and heart disease still. Mm-hmm. Like the big ones.
Always number one.
They never cared about that anyway. They were never going to help anyone with heart disease. So I'm not saying it's the best use of their time, but they never cared about this stuff. They said, don't smoke, go on a diet. That was their
That's all you can really
advice.
Do. And then meds, and then, yeah. But that's the best way. That's the best way to treat it. Diet and exercise.
Diet and exercise. Did they really drill that home?
Yeah, really do.
Last time I went to the doctor, he was like, what are you doing here? Because I was like, something happened. It was too hot in the dance class, and we're going really heavy, and then we just stopped. And when if I go super super heavy and just stop, sometimes I'll just like, I need to keep going, or else I'll like almost faint, which is a weird thing. I think it's like.
But you need to keep exercising.
I need to keep exercising, or I'll faint. I have to cool myself down. It's like a low.
Cool down. Got you.
It's like a low blood pressure thing. I actually he didn't even do that. He didn't even take my blood pressure to be like, oh, maybe you have, my resting blood pressure is pretty low. Mm-hmm. Which is why I'm like, yeah, I can have coffee, I can have sugar, it's fine.
You're treating it.
It's just my resting blood pressure. And he was just like, well, what are you even doing here? Yeah, keep going to dance class. And I'm like, well, I'm not coming back to the doctor anymore. You didn't help me at all. You didn't give me any tests. You didn't run my blood. You were just like.
That should have happened.
You look fine.
You got to get tests in labs. But I'm not saying you, but like that doctor should have done that.
Yeah.
But as far as what he was saying, I agree with what he's saying.
He was just like, you're fine.
Good. Yeah.
You're fine. Get out of here. I got to treat other people.
But even the checkup's going to go away. Because, I mean, studies have like kind of shown like the annual physical. Yeah, it's okay. But a lot of those things you really don't need to check for annually. Like, there's certain age-specific things like your prostate, breast cancer, stuff like that. But, like, unless you have, like, lab abnormalities or your specific symptoms that are suggesting, oh, let me focus on the cardiac exam. Like, every year, you really don't need to get certain, like, physical exams. And even now, like, the doctors you see online, where are you getting a physical exam from that?
Oh, yeah.
So it's like...
I went and I saw online because I won't go in. And yeah, she just looked at me. We had a conversation. I'm like, how do you tell anything from this? This seems like a drug deal. She didn't prescribe me anything, but
yeah.
Anyway, in California, you can go on a Zoom call and talk to a doctor, and that doctor will give you a marijuana prescription. People at home are like, what is she talking about? That's what I'm talking about. We got so off topic.
Yeah, sorry.
No, it's okay. I'm always in my life. I'm like, the doctors are always like, "Why are you here?" And I'm like, "Because I have to have this exam every year. You called me." And then they push me out the door. They don't care. Anyway, okay. So I was watching a podcast. It was Finding Hermes. It's super metaphysical. Like, it's way out there. It's one of the more out there things that I watch. And this guy was on. This guy called Mo Bedard. And he said he became a completely different person when using meth.
It's probably true.
How can that happen?
Like change his personality?
Change his personality.
How is he now? Because I'm sorry I didn't hear the episode. Like, how was he compared to before? Like, did he say anything specifically about his personality change? Or just...
So he was having a problem with meth. And now his son is having a problem with meth.
Okay.
So he was saying his son was a different person. Once he stopped using meth, he was fine. But he said that during that time, that he would entertain ideas and thoughts and actions that he would never have otherwise entertained.
Got you. So that's probably speaking to like the indiscretionary behavior that you can see in like mania, doing things without thinking, or thinking like when I say doing things without thinking, like going down certain paths without a plan. That's basically what I'm saying. So I'm going to write this book. I have this idea for a novel. Let me take a couple days, not sleep, and just write 1,000 pages. That's where that comes from. It kind of like stimulates the creativity centers of your mind and like pushes you down this path with all this energy and all this good feeling, and you can't stop. So that might be the personality change he's referring to. And then when he's off the meth, oh, I'm back to normal. I don't have that anymore. But if you continue to use it, yeah, you could potentially do that. And now you're going down this road where you're now saying these things and doing these things, but now you spend all your time doing these things that you've neglected everything else in your life, and then it leads to you losing your job and all this other stuff, and then it leads to you spouting these things on the street to random people that now it dominates your life. Mm-hmm. So that's how it could progress in the most simplest way. But there's other things that go into it, but I think that's the personality changes he might be doing it. And then even with drug use, it kind of gets built into your genetic code now. So that's why you like alcoholism is hereditary. If your mom or dad had a history of it, chances are it increases your risk of becoming an alcoholic and being more susceptible to it, just because of exposure, the nature versus nurture argument. Part of who you are and everything is mostly environmental compared to genetic. But if you do it, like if you have it and you have it in your family and they've suffered consequences from these things, chances are increase your risk of doing it.
When you say genetic,
yeah.
So you mean if a drunk, an alcoholic, I don't want to be insensitive, gives their child up for adoption, is that child more likely to drink?
Potentially, yeah.
That's interesting. Is that like epigenetic stuff, or is that
kind
genetic?
of? It depends on the severity. Depends on a lot of things, and again, it depends on the kid too. So if the kid was conceived and mom was using, then already you're developing fetal alcohol syndrome and things like that, and there's a whole myriad of symptoms with that: aggression, facial abnormalities. When I say that, just like palpebral fissures, shorten, and like a long like nose to lip distance. Okay. Yeah, it's called the philtrum area. And then aggression, indiscretionary behavior, increasing your chances of like schizophrenia and all these other things that are now in your genetic code from the alcohol use from mom. Mm-hmm. So if we're seeing that, chances are the nature part of it is the habit forming part that, oh, this is what I saw dad do to kind of help him kind of calm down. Let me start doing that. And then the mom part, oh, I have this history of indiscretion, and that combination.
That's interesting. Lead to that. I would like to see if they have studies of people given up for adoption as babies, if they're more likely to be drug addicts, if their parents.
I think they do have that. Mm-hmm. I haven't seen anything. I haven't done any research with that, but I would, if I had to guess, I would say yes. If I had to guess, yeah.
That's really scary.
Yeah.
Yeah. That comes down to nature versus nurture. And you don't want to even think like that, mm-hmm. that this person might be more susceptible.
Yeah, it's just, I don't.
Because this
sucks,
guy,
man. Yeah.
This man's son, but he was raised with him, turned into a drug using the same drugs.
Did his son say why he started using?
This was the father.
Okay.
He was talking about mold. The podcast was actually about mold.
Oh, okay.
And how mold, even in trace amounts, can have really harmful effects to people.
Yeah. Yeah, that's true.
So maybe they all lived in a really moldy house, and that's why they all went on meth. I don't know enough about this mold stuff.
Yeah, there's like a lot of fungal diseases and like aspergillosis and like asbestos isn't really mold, but like let's see. There's a fungal infection that can cause like brain deterioration, stuff like that, and black mold, stuff like that. Like mold can really mess you up neurologically.
That's so interesting.
There's so much stuff out there. And like as a psychiatrist, like we try our best as far as like treating these things, but sometimes it might be like a mold causing these things. And yeah, my medication might help like temporarily, but it's like I need to do tests for mold to see if this is the cause, or maybe this is HIV dementia leading to aggression. Maybe this is a hyperthyroidism that wasn't properly screened or treated. So a lot of other organic medical conditions can mimic these disorders. So what we might think is like drug use leading to this, no, it could have possibly been the environment that led to this kid doing it. Just the alcohol didn't help, but or I'm sorry, the meth didn't help, but it could have been this other thing.
So you gotta be careful for mold.
Yeah.
No one ever thinks about mold, but you gotta be careful.
Exactly. And in LA, I mean, there's not a lot of new houses out here, and all the new houses like the really, really, really rich people get. But like if you're trying to buy a house out here, it's usually a very, very old house. So definitely gotta do that check if you're buying in any big city like LA or New York or something like that. Even Miami, the whole building collapse thing.
Probably mold all throughout there.
Yeah, 100%.
Yeah, it's got to be because, that's actually really scary. Because I know we know people who were living with mold for a long time. Mm-hmm. And to think that we know it can mess up your health, but to think that it can mess up your mental health so that maybe you make a decision that you think is a logical decision. But really, you went and you broke up with your girlfriend. You accused her of cheating. You broke up with your girlfriend. And really, that was just mold in your head or something like that. That's a life-changing decision off of.
Yeah. But usually, before everyone thinks, oh, mold made me act this way, you'll see other symptoms and signs. You'll see fever. You'll see tachycardia, fast heart rate, tachypnea, fast respiratory rate, I said tachycardia, but other things, systemic things that you'll see with mold infections, fungal infections.
That's so interesting. That is really... Wait a minute. So if this guy's personality can change, and people's personality can change, do we have a true... Does a person have a true personality, or is it all just circumstantial?
I think people's personalities can change. Like everyone, I think you're constantly developing it through your perspectives and through your experiences and through your ability to be malleable to these experiences. What I mean by that is growing up, you're trying to find yourself. You're trying to see what you like, what you don't like, all these things, how you talk, how you sound, stuff like that. And then you're making you. But let's say like you came from Rhode Island, you came out here, you probably started talking different, you probably started dressing a little bit different. Maybe you didn't, but that's part of your personality too. So your environment is part of that. But maybe if you didn't do that, you're just like, nope, I am who I am. Rhode Island for life. I'm out here. I'm repping Rhode Island. I'm dressing like Rhode Island. This is my personality. Nothing can change that. I don't care what you say or do.
It's a big
Miss
hoodie
Rhode
and a
Island.
Dunkin'.
Yeah.
No,
Coffee,
no.
milk, every day, 5 times a day. So
Okay,
I think it's malleable.
It's malleable. It's malleable, and I think it's not. Because your daughter has a personality,
Mm-hmm.
and she just got here.
Yeah.
And my brother said that about us one time, my oldest brother. He's like, y'all are the same way as you were since you were babies.
Mm-hmm.
Like, I didn't cry. The other one cried constantly, still cries constantly. Can't even deal with it. But is there something like that? Like,
Yeah.
you came out of the world, and you were a certain way.
Yeah,
You're
you had a
just-
certain temperament. This is how you are. This is how you react to stress. So that could be your stress response as well.
So temperament and personality are different.
I think temperament is part of personality. I think it's just an element of it.
Okay.
So like that example I used with the changing of how you speak and what you wear, I mean, that's just part of how you identify yourself.
Mm-hmm.
And some people's identity are part of their personality. What I mean by that is like not identity as ego identity, but like how you show yourself to the world through what you wear, how you wear your hair, how you talk, stuff like that. So,
And that can change. That
Yeah.
changes a lot through people's lives. Through,
Yeah.
Teenage years, they go through phases and stuff like that.
but also like you could be a person that was happy, had all these things happen to you, and I'm sorry, not have these things happen, but like happy at a certain temperament, and then you went through something traumatic, and then it could change your personality too. Now you're more on edge. You're not happy. You're angry all the time. All these things, and it's because of unresolved trauma related to that thing that happened to you that changed your personality, your demeanor, how you react to the world, how you fit in the world, stuff like that. So
Yeah.
I think some experiences can change your personality, but like you said, if you're a person that like no matter what, you're always acting this way, you always feel this way, don't cry or always cry, maybe you apply that to that traumatic situation and you're still the same person on the other side, but then your defenses come up and you're not showing, you're not being truly vulnerable, you're not processing it, you're not, your personality is set in stone. Nothing's going to change it.
Okay, that's interesting. I'm not sure. So is that like PTSD does that? Will change your personality?
It can, yeah.
PTSD, the
So
trauma?
Post-traumatic, stress disorder is basically an event where you feel that you're going to die or be seriously hurt, or an event a personal friend to you or family member, someone you know, observed, or something you directly witnessed but didn't happen to you. Through that, you develop a lot of symptoms. You can develop hyperarousal, so like any little noise makes you jump up or be in attack mode. You can be avoidant. Things that kind of are similar to that traumatic event, you just completely avoid. You can have flashbacks, so you could be me and you can talk and you can say a word that triggers me, and now I'm in that environment and my world now changes into that environment, and I have those responses to that environment presently. So then you might react, how you're okay, you're acting kind of weird, you got really aggressive, you yelled at me, this isn't like, so you can have flashbacks, and there's a lot of other symptoms. So if you're a person that wasn't like that before, and this is how you're responding to stress now, that could be post-traumatic stress disorder. So you have to properly process it, work through it, and go on the other side of it and say like, you survived, you're good. Let's get these symptoms away from you because it's causing you a lot of physical stress, mental stress, and get you back to a point where you're comfortable, back to the old you or a new version of you.
That's interesting.
Either one.
So, a lot of these people on Soft White Underbellies, you watch Soft White Underbelly a lot?
Mm-mm.
You work it. You don't need to watch it.
But I've seen it. Before, I see one of my friends showed me the Meth video before you did.
Oh, really?
Mm-hmm.
Wow. Well, she's entertaining.
Yeah.
You know, she went viral. But a lot of them, most of them, say that they had trauma in their childhood. Is that childhood trauma, post-traumatic stress disorder, or is that different?
So it can be different. Right now, they're kind of they're developed a system in psychiatry and all health called trauma-informed care. So basically, you're caring for someone's illness and all this stuff, but then you're really considering the trauma they went through. Because when you're getting a history, you're going to ask about trauma no matter what. So there's a way to ask about it that's somewhat sensitive in a way that the person will open up to you. So part of that is they're working these things called adverse childhood experiences, ACEs, and it's like a big long checklist. And what they're seeing is if you score really high on this checklist, you really need to address it and really consider it when these other diagnoses are going on, the depression, schizophrenia, all this stuff. Lower numbers, not too much, but it's all about risk stratification, stuff like that. So PTSD is usually in reference to one event or prolonged exposure to an event. So, I mean, I'm sure we all know this, but like people associate PTSD with war, stuff like that. But you can have post-traumatic stress disorder if you're in an abusive relationship, if you're in an environment where you feel like you have to carry a weapon on you in order to make it day to day, or you're in an environment where you could die any day because of that's the mindset. Like people don't consider that as post-traumatic stress disorder, but that can be something too, and that's an adverse childhood event as well.
So could the media give you post-traumatic stress disorder if they keep telling you you're under threat?
So it's not written in our bylaws, the DSM, really, but I think it should be added as far as chronic media exposure, putting like all this fear in you, like the Fox News, the CNNs to MSNBCs. All this is like bias, a lot of times one-sided view of something. And then if you're constantly watching that every single day, it could put that state of fear. And again, without empathy and perspective, going out and talking to people who don't look like you, who don't, have the same background as you, you're going to think that. And that's how the bubble forms and that's how it stays. I
think it needs to be added soon because of COVID. I probably have to not even say the C word, but people are like, I'm going to die if I come in contact with somebody who has it. And if a person doesn't get vaxxed, they're going to kill my family. And it's like, okay, chill. It's not going to be good. And you should not come in contact with it. And you should take every precaution you need. But you think you're going to die if you come into contact with your whole family? This is a bit much, and they've the New York Times had the nerve because they send me a newsletter every day, and I just watch it and read it just to be like, okay, what are you guys trying to sell me now? At this point, they had the nerve to say, turns out the U.S. media was a bit alarmist over COVID, and here's the numbers. And I'm like, that's you. Yeah. You're the U.S. media. You're the alarmist one. And then you go to the other side now with the big V. Mm-hmm. The other side, the V hesitant, are like, if I get this, I'm going to be dead in 3 years. Mm-hmm. And they believe that. They absolutely believe that. Mm-hmm. They believe all these. And, I'm not saying for a fact that they won't be, but like, everybody would be dead in 3 years. I'm you know what? We're going to wait and see. But like, they're genuinely terrified that something very bad is going to happen to them, as scared as people are of COVID, of this. So
two big things. I completely agree with everything you're saying, and it's hard because like there is no right answer in my opinion. But I think this is going to be the next step. So the NFL, have you heard about what they just did?
Did they do something today?
Nah. So recently the NFL made rules because they want everyone to get vaccinated, or at least a certain percentage of the teams. So the NFL said, we have these rules, social distancing, all that stuff. If you're vaccinated and you catch COVID, you have the protocol and you have to get tested, a couple tests in like 24, 48 hours. If you're fine, cool, they'll do contact tracing, same stuff. If you're unvaccinated and you get other people on your team sick, they'll try to reschedule the game because they did that last year. But if they can't reschedule it, you'll have to forfeit your game your whole team loses money, and the other team doesn't get paid either. So basically, if they found out you're unvaccinated and you're the cause of all of this, then that's what happens. If you're vaccinated, they're going to try to figure out what's going on, blah, blah, blah. So basically, they're saying get vaccinated now.
Mm-hmm.
And the numbers jumped up for players getting vaccinated. That's NFL. I think that's going to happen in the future for people with jobs. You got to be vaccinated. It's required. If not, you're fired. And even in California, specifically LA County, state of California, and New York, they just approved for federal jobs. So my job, which is what we were already doing with this, but they're saying if you work in a state job, you either have to show proof that you're vaccinated or you're subject to weekly testing, non-negotiable.
Which is fine.
Yeah. And I'm
down
fine with that.
weekly
That's what
testing.
we do now.
Yeah.
But if you ask that to certain people, they'll be like, I don't even have to say it, but a lot of people are against that. But I think it's even going to be worse. It's going to be more things coming down the pipeline because you just have to get this stuff in check. So
I know yesterday the postal union was like, nah, we're not doing this. Because Biden was going to say, well, maybe we could. The postal union was like, no, we are not encouraging forced vaccinations yet. So the postal union is coming out against that. A lot of the big unions
about vaccination, forced vaccinations.
Yeah,
they're not asking for that now though.
No, they're not. But they've already come out and said we're not on the side. The religious, I'll find the article of England are saying no, we can't have the government doing vaccine passports. So it is really a tricky legal situation because this thing is not approved yet. So what happens if something goes wrong? If something goes wrong in a year or two?
Yeah.
Who's liable?
Yeah.
Is it the NFL? It's not the company. Like, who's paying for the medical bills if something goes wrong?
That's the thing.
Is the federal government? Like, because someone's going to sue.
Yeah.
Someone's going to, I mean, even if these are, as far as we know, these are safe, as far as we know, but there have been adverse events.
Mm-hmm.
So if your company forces you to get this and you have an adverse event, well, who's liable?
Exactly.
It's not the government. It's not the vaccine company.
Yeah.
It's your job.
Yeah, that's true. And you're putting it all on the job, and maybe the job won't be able to handle it, and all they can really say is, "Gotta let you go." And
no, but the person is gonna sue.
Yeah.
Because if it's they had a shock or they're allergic to whatever is in, just one of the ingredients, not necessarily whatever, but there are adverse reactions to regular vaccines that were developed, 30, 40 years ago. And those are recorded.
Well, maybe jobs will basically say make waivers. I think they'll probably do waivers. Like if you accept this job, then you have to agree not to sue.
I can't imagine that. I can't imagine that holding up in court though. Because it's
who knows?
Not
it's
FDA
a whole new ball game. Like if you're mom and pop and you have to hire people, and that's like mandated by the government. If you work, you got to have a vaccine.
They can't. Yeah. They won't. They won't. They won't because they can't mandate regular vaccines now. They can for schools, but they can't say if you work at a pizza shop you have to have a MMR vaccine.
True, but I'm kind of referring to your point, like postal workers, stuff like that.
Postal workers,
places where like people that go multiple places, stuff like that. What if they like require them? Like you said, the union's against it.
The union's not going to put up with it.
We'll see. Whole nother conversation. They might do away with unions.
They can't. Court decisions. That would be terrible. I am so pro-union. The unions are against at least big federal unions right now are against these vaccine mandates. But in general, I think unions are a great thing, and they're maintaining wages, and they're maintaining wages for, I don't want to go into a whole thing, but they're maintaining wages for adults who are working. And if we're going to be perfectly honest, 85% of C deaths are retired age.
Yeah.
So are you really gonna turn on the youth and the adults for the elderly? This is a question we've never asked.
Yeah.
Legally, there's no precedent to it. Mm-hmm. And then to force people to get something that's not FDA approved, if something goes wrong, anything goes wrong, what are the lawsuits going to look like?
True. But I think the FDA approval is probably coming down the pipeline because a lot of people, that's been their last barrier to getting it. And whether or not, I don't want to say anything about anything, but when I think it does get approved, then they're going to be like, it's approved, then what are you going to do there? Because it's like...
Well, then we have a different conversation.
Are you going to, not CDC, sue the FDA? Like, are you going to be a Supreme Court decision? Like, I don't even know.
That's a different conversation. Once it's approved, that's a totally different conversation.
Yeah. I think it will be, though.
Okay. I mean, we're definitely going to see. I think the testing is up in 2023, so.
Yeah.
I don't know how they can approve. I mean, right now, like.
It's way too fast. Yeah. It takes so long. Like at least 7 years. No,
they say they want the approval in 2022, but I don't know how they can do that if the testing's not done until 2023. Just from a legal standpoint, I don't know what they are supposed to do.
Yeah.
And then are they liable if a customer comes into their office and catches it from the office? Or is it like a filming thing where there's a sign on the door that says, if you walk in here, you're being filmed. So don't complain that you're on camera.
Yep.
You're being filmed. So
I would just have on the door, there's a risk of coming in here of catching COVID. Enter at your own risk. Everyone's going to have that on their businesses. So that's a way you kind of get around. No shoes, no shirt. You might catch COVID. No service.
In California, people at home probably don't know this, but in California, when you walk into any business or something on the door that says there is cancer-causing chemicals in this business, maybe that's what it's going to be.
Yeah.
I'm looking at it from a legal standpoint, and I just don't know how they can do this. And I don't think that they should. Because once they do it, well, what's the next thing? And then what's the next thing? And then what's the threshold for the next thing? They're not going to stop at this.
Yeah. I have to say on the flip side, in my opinion, this is my opinion, if there is no mandate, we'll still stay at, 51% of the country, I think, is vaccinated right now. And we need much higher numbers of people getting it in order to deter the possibility of more variants coming, because that's how viruses thrive. If everyone's inoculated and everyone gets it, it really doesn't have a place to run in order to build up its defenses and morph and mutate and then come back with a vengeance. So if only half people are doing that, there's many more places to do this and then come back, and then we're going to get these variants every year. We're going to get mass mandates every year. I think we're going to get shutdowns every year.
We can't get shutdowns every year. It's going
to be like, fuck it, like you said. It's going to be the war between the young and the old.
What's going to happen is just going to be like,
unfortunately,
immunocompromised.
Immunocompromised, yeah.
It's like the flu. It's one of those things. It's just like
we are seeing young, healthy people catch it, and some being hospitalized. I'm not saying obviously not as high as other people. That's what I'm fearful of. Variants where it's like it doesn't matter what you are. We're attacking you, and you're feeling the symptoms just like.
If it gets to the kids.
Yeah.
That's my biggest fear, because before it wasn't getting to the kids. The kids were, I was like, something out there looking out for the kids. Thank the universe that someone's looking out for the kids. But if it starts to get to the kids, and it's a problem, it's just going to be a problem. Like, we're stuck with this.
Yeah.
We were stuck with this forever.
And all that. And
sorry, we're going to have to pause for a sec.
No problem.
We're good.
Okay. So we just had to change cards. Nothing else happened during the break. We just had to change cards.
Got some coffee, milk, we're ready to go. Let's get it.
But yeah, you were saying about what your friends have seen in the ER.
Mm-hmm. Yeah, so like they're really pushing for the vax, especially in our community where we just have a lot of illnesses and conditions that we're susceptible to. And, we're rightfully so, distrustful of the medical field and the government, stuff like that. So it's been an uphill battle, and I trust my ER doc friends who are there every day fighting COVID and have been, and just what they've seen anecdotally, and I trust their opinion. So that's what really turned it for me.
Yeah.
So they're still pushing for it now.
So you would advise people if they have any health condition, if they have high blood pressure, if they're around any elderly people, or...
Yeah. I would just say, my opinion, anyone can catch COVID, vaccinated or not. The risk of being symptomatic, resulting in hospitalization or death, when you're vaccinated, dramatically less compared to unvaccinated. No matter what, just go see your doctor. Go check in. See how you fare. And I would just have a conversation with your doctor. Get your own information, own research, too, and then make an informed decision. And even if you don't want to do any of this, please socially distance.
Socially distance.
That's it.
Yeah. I could do the masks for a while because I noticed I haven't caught a cold this whole year.
Exactly.
Last year was really bad. Like the 2019, 2020, we all got really bad colds and flu. The whole office got really bad cold and flu.
Yeah, we probably all had COVID then.
We probably all had COVID.
Mm-hmm.
Honestly, because we were testing constantly and nobody came up with it. Even Brennan, his girlfriend, got it, and he was fine.
Yeah.
Like, what? But yeah. And we were also saying that there are risks with it. And so you just have to be aware of what you're getting into.
Exactly. Yeah. Informed consent.
Informed consent. Yeah. Jimmy Dore went on Joe Rogan and talked about his bad experience. And now I'm like, okay, well, now it's going to come out.
Yeah.
It's going to come out. But what are the risks?
Exactly.
What are the risks? You got to run the numbers and find the risks. You're saying at 51%.
I think 51% of the country, I believe, are vaccinated. I think.
But you got to take out for kids.
Yeah.
So once you take out for kids.
eligible. Yeah.
Okay. I think it's higher.
You think it is?
I think it's higher, but it might not be higher for the age group and for the Black community. I think it's fairly low for the Black community.
Yeah, it's terrible. It scares me, man. I don't want us to be sick. I want us to advance. We're making headway, and we need more people that look like us here for support, physical, mental, emotional. Last thing we want is for you to die and then have that grief and say, oh, I should have done this. And put on a mask for that person, for yourself.
At least indoors. Put on a mask. Outside, that's different, but indoors.
Specifically if you're unvaccinated. I know the new law is if you're vaccinated, people have to wear masks too, at least in California. But
everyone got to wear them.
Yeah.
Except we were on camera, so we don't. And
yeah,
we're cleared.
Yeah.
Yeah.
Cleared. Sorry, I had to say that too.
We're cleared.
My bad, yeah.
No, I was tested. I got tested this morning, so.
I'm clear, yeah.
Did you get tested
I
regularly,
get
even though
tested every day.
you get tested every day, even though you're.
Yep.
Okay.
I choose to get tested every day. At my job, we have to do weekly PCR tests if we're vaccinated. But since I have a little one at home, I'm choosing to do it every day plus that. Overdoing it. So
yeah. And you know what? Until we figure out what happened and what's going on, this might just be a thing we live with.
Yeah.
Forever and ever, just like the flu.
Yep.
Because they couldn't keep the Petri dish where the Petri dish had to be at their stupid little lab.
In Wuhan?
Yeah, and now everybody got to deal with like a super flu forever and ever. So, way to go.
So that super villain doing this at home, he or she won?
It wasn't even have to be a villain. They just screwed up.
Yeah, that's true.
And the fact that they're not letting us in to look around like, y'all definitely screwed up, didn't you? Just say you screwed up. I feel a lot more people would be amenable to getting it if they would just come out and say, we screwed up.
So you think it was man-made in the lab? Because, I mean, coronavirus has always been out there. I learned about coronavirus in med school, but it was one of those like gloss over things like, oh, here's a different type of virus, coronaviruses. Here's the mechanisms. And they talk about spike protein, all this stuff.
Yeah.
Next question.
Yeah. No, there are definitely. I just remember when it first came out, when you could go on Twitter and find what the doctors were talking amongst themselves about. And they were like, yo, this looks like it was, this doesn't look like it came from nature. And then after the official word was it came from nature, all those doctors got quiet. We're like, yeah, it came from nature. I need funding. So it came from nature. So I'm like, you all said before when this first was hitting that you said it didn't. So what's going on now?
I don't even know.
You get that funny
money runs the world.
Right?
So I wouldn't put anything beside money.
We're not going to have, there's not going to be, we're supposed to talk about meth here. But, I mean, that's what it is. It is kind of the media. I'm seeing both sides get worked up to the point of the PTSD with this thing. And it may have happened over Trump, too, where the media was doing scare tactics. Definitely. But, like, the past year, I've seen the media, like, trying to make people fearful. And I see a lot of old ladies just...
Yeah. That's where they're getting their information instead of reading studies and all those things. But also, I can say the media has tried to make you distrust science, which I don't know. That's a whole conversation in itself. But that's what the media is doing, too. So even if you present objective data from a credible source, nope, part of it.
Yeah.
Not true.
Well, there's a critique on all of science, which may be fair. Yeah. Because we do need to have studies that confirm what people find. You can't just have a study, put it out there, say this is the truth. Like, okay, follow-up study. Is this the truth? Is there any incentive in doing that study? Blah, blah, blah. So there's a critique on science in general. But to apply that critique on science to everything that every scientist comes up with, like, come on. It's not...
Yeah.
Everyone's lost their mind. Everyone has lost their mind this past year and a half. Like, since last March, everyone has just flipping gone crazy.
Yeah. And sadly, technology has helped in that because now everyone has a voice that others can hear, friends, and getting out there. So you might have a belief, but if you have a lot of followers or you're an influencer, your message is going to get out there, and then that might be the message that other people link onto and then use as part of their sources. So it's just, it's what it is now.
You got to be wary. You got to go. If you can understand firsthand information, go to the firsthand information. If you can't understand the firsthand information, most of us can't, because we're not going to read scholarly articles. Put your mask on and socially distance. If you're not going to get the jab, put the mask on, just like it was last year. And then when the FDA approves it, if that's what's holding up, if that's what's holding you up, then that's what's holding you up.
Yeah.
We'll see about that next year.
Yeah, we'll see.
Agreed. We will definitely see. Okay. Back to crack and meth. I sent you another video with Evelyn, the older lady from the Tenderloin in San Francisco.
Yeah.
What did you think about Evelyn?
Evelyn was unique. I liked Evelyn. She was cool.
I liked Evelyn a lot.
Yeah. She had quirky phrases, and she was just quirky. Yeah. And I don't know. I mean, with her, I don't know. I really don't see the major difference between Evelyn and Graciela. Was her name?
Diamond. Her name was Juliana / Diamond.
Sorry. I mean, you really, like I said, you really can't distinguish the two. If I were to see them on the street and they're acutely intoxicated, and even, I don't know if they're acutely intoxicated in the videos, but like, meth is just so much more damaging compared to cocaine.
Yeah?
Yeah, long term. That's why, like, it's really scary. Meth is a lot cheaper. It's more West Coast, but now it's spreading throughout the country. When I was in med school in Detroit, I had maybe one meth case. I never saw meth. It was mostly heroin and alcohol and all the other stuff. But meth was mostly West Coast. But now it's going everywhere because it's so cheap. But just the fact that it's so more addictive and you need more, and it's more potent. When I say potent, like longer lasting compared to cocaine, it just has a greater chance of affecting you and a greater chance of causing more damage compared to cocaine, even though they both can cause the same amount of damage, very person dependent. So maybe that's why meth looks so worse in the other person compared to Evelyn.
Yeah. Evelyn seemed like some of the stuff she was saying was making a lot of sense. Does that...
No?
Some of the stuff she said just like hit home. Like, I actually wrote it down. She had a phrase. It was like stream of consciousness.
Yeah.
She said she was on a riverwalk and just had Monopoly money. I was like, wow, that's college, right?
Yeah.
But obviously she's just talking.
Yeah.
She's not making any sense.
So to her, it's like maybe she does have some experiences from the past, and they're kind of flowing, like you said, stream of consciousness, which you can get. You're like unlocking a lot of the executive functioning, planning. And that's not just what you do day to day, but just the way you structure your sentences, the way you communicate. All those barriers are gone. No commas, no periods. Thoughts just intermix with each other, and they might not make sense to you, but to her, they make perfect sense. She's describing college. To you, you're like, what the fuck are you talking about?
No, I'm finding meaning. I find meaning.
But is it the meeting she attended?
I have no idea. I don't even know if she knows minute to minute what she has said a minute ago.
That's true, yeah. So, I mean, it's possible. There's times where, they come back to earth and they make plausible sense, and then they just say these random phrases that may not make sense in the whole conversation, non sequiturs. So that's why, like, whenever you're talking to someone, you want to know their world. You want to know, does Monopoly money mean something specifically, or is it just a random phrase that she just randomly said because maybe she played Monopoly as a kid and that's what she remembers at the time. So, I mean, it's possible. It just messes with everything in the frontal, in your cerebrum and the prefrontal cortex and everything that's in charge of just organization. So it could break all those barriers down.
It's so interesting how she can still say coherent words and sentences, but she has the meaning behind them is just so lost. But she hasn't lost the ability to speak.
Yeah. So it might be like a word salad is what they call it, when you're just like saying random words that, yeah, they're saying words, but they don't make sense together. You're just destroying that specific part of the brain, which you can have with cocaine and meth. They've shown there's been some data and some studies that actually these drugs can affect the receptor. So when I was talking about releasing the neurotransmitters, they have to hit the receptors, so a place that catches them on the other transmitters. So if you're releasing these things chronically, the amount of receptors on the next neuron will go down. So it takes a higher amount of that neurotransmitter to have the same effect as you did in the past. Or it can cause some damages in that next firing of the neuron. So it could be a lot slower or not as a big effect. So it's not as pleasurable, not as euphoric. And then you destroy those areas too through even other mechanisms like microglia, which are like the trash cans of your cell. So they've seen that these drugs can have an effect on those things, causing increased breakdown in like cell bodies and things in your neurons, with specifically meth, but also with cocaine. So you're destroying a lot of the gray matter in your brain.
You're frying your brain. That's what people call it. They say this person's fried.
Yeah. So once you get to that point, like I said, brains fully develop at 25. After 25, you got what you got. So if you're destroying that, there's really not a lot coming back. There's some evidence of some drugs and some things that can promote brain development and helping you build more neurons, but all that's in the very beginning of life, and then it stops. So that's why when you're young, you're like a sponge. You're basically like a fast-growing tree. That's what your brain looks like. So if you're pruning all those branches, when it doesn't grow anymore, it's not coming back. And that's what drugs can do chronically, in some individuals compared to others.
And when you're talking about drugs specifically, meth, crack,
anything, meth, crack.
Does heroin mess up your brain?
Heroin just messes up the neurotransmitters and the receptors, not necessarily brain. Because heroin operates in a different system. It's like mu and opioid receptors in your brain. And again, these are found in areas that are in charge of pleasure activities, emotional memory, things like that, the limbic system. So you're decreasing the amount of receptors on those things. So again, it causes you to have to take more of these drugs in order to get the desired effect. More of anything can cause a lot of negative consequences. So,
okay, and but psychedelics and marijuana, they don't have the same brain-destroying effect.
So that's what we're studying now. We've seen that psychedelics can be helpful because it kind of makes you in a more of dissociative state, and with that, you're kind of separating from the trauma. You're separating from the problems that you're having in this emotional memory. You're kind of doing depersonalization, derealization. So depersonalization is like an out-of-body experience. Me coming out of my body looking at this situation. Derealization is the world is not real around you. So you're aware that the world is not real around you and you're questioning it. So if someone who's in a trauma and this is all they're thinking about, let me take this drug to get you out of this experience, to look at it objectively, and then process it and go through it. Or this world I'm living in of hypervigilance and avoidance, let me change that world and let me process it through that. So psychedelics have a hand in doing that. And that's why it can be helpful. As far as the destructiveness of it, that's what we're kind of studying, because that's why microdosing is important and not really being taking too much so you're stuck in that world, because again, too much of anything can be bad. So that's what we're still studying right now.
Right. Not from my personal experience, but people I know, that acid can be too much.
Yeah.
You can do too much acid. I don't know if I've ever met anyone who's done too much mushrooms.
Yeah, I really haven't either. But again, I don't really know. So anecdotal again, it can. Anything has a potential when abused. But you're right. I've seen acid and LSD definitely cause those negative effects.
If they were going to study ayahuasca, sustained use of ayahuasca, then you could go to like churches. There are churches, Santa Dime. They do it a lot. So you could see these people who have done it hundreds of times. But then, that's a very specific set that's already been pre-chosen as sort of a shamanic figure or whatever, so that maybe this is not a good sample. You know what I mean? It's not. It doesn't reflect the general population.
That's true. and they guide you, and like you said, they have better experience. So I really can't comment on it. So if it's helpful and it's something that they've done, it's my job as a physician to look into that and look into there's probably not a lot of studies because it's been illegal. So I'm put into a compromising position where it's like, yeah, this is what it can do. I know the effects of it, but as far as the long-term use of it, I don't know. As far as me using it to help treat you, I would like to. Don't have the ability to, and I would like to study it and read on these studies. So it's kind of like half in, half out.
Well, first you need a drum.
Yeah.
You can't just be in there. You got to get yourself a drum.
True.
You got to turn out the lights. You need candles and stuff. There's a whole thing. You should leave that to the professionals.
Yeah.
Dr. Donald.
100%. I'm going to be honest. I have not studied that, so I really can't comment on it. But I would like to learn more about it, and I need to, especially if it's coming down the pipeline. So I have some colleagues who actually have studied and actually used psychedelics in treatment. So I defer to them. Mm-hmm.
That's because of the mushrooms?
Mm-hmm.
Okay.
So they've used like ketamine. So ketamine is like an analog, kind of like similar to like ecstasy and similar to, it's a drug. It's a dissociative drug. So ketamine we use to kind of like sedate kids for surgeries. One of the major side effects of it is that can cause like weird dreams. When you're an adult, you have your past experiences. So that's why we don't use ketamine, because it can cause nightmares in adults. But for kids who haven't really seen the world, just pleasant dreams. So that's why they use it. So we're using like ketamine infusions, ketamine drips to kind of put people, very, very small doses, put people in this like dissociative state and kind of like talk to them, work through them through trauma-based cognitive behavioral therapy and other therapies at the same time. And also we've noticed that people with ketamine have like dampened responses to hyperarousal, hypervigilance, things like that you see in PTSD. So we've noticed that it's actually made it go down, reduced it.
Nice.
So preliminary things, but I know that they've approved it in certain clinics. Of course, I don't use it personally because we just don't have it available to us. But like in the private setting, it is available and has been helpful. So I think that's coming down the pipeline.
That's really interesting.
More common use of it.
And so they're about to pass recreational. I don't know if it's recreational or decriminalize mushrooms in California.
I think it's which one is it? Is it recreational? I think it just might be recreational. Or both.
Recreational is quite a leap to do recreational. Or they're not going to... Let me check. Proposed California law would legalize magic mushrooms, MDMA, LSD, and other psychedelic drugs. Oh my God, I'm going to sound like a grandma. I don't know if you should be able to buy a bunch of LSD in the store.
Yeah.
Because first off, someone's putting it in the punch bowl. And you don't know how these people are going to react to it.
Exactly.
The MDMA and the other ones, okay. But the LSD, I don't know.
I don't know. Ecstasy's scary too. Molly and all that stuff. Just because of the side effects of it. Just the severe dehydration. That's why, like, when you go to, like, raves and stuff, people wear, like, very bright clothing because it causes, like, a synesthesia where you, like, see sounds and, like, kind of messes with your senses, enhances them in some way. They usually dress light because it causes you dehydration. They usually wear pacifiers because it causes bruxism, so you're, like, grinding your teeth. So they're basically, you encourage water use and all these things, but I don't know. Someone might ignore all that, and that's when you get a lot of the deaths, the seizures, stuff like that, convulsions, all that.
From dehydration?
From dehydration.
Mm-hmm. Okay.
Related ecstasy, MDMA, Molly, all that stuff.
So that is really interesting. And I believe that most adults should be able to buy LSD in the store. But it's just the opportunity for abuse of a vial of LSD.
Mm-hmm.
I mean, the CIA, they abused it the most. So we know the abuses of LSD because the CIA did it all in the 60s.
Yeah.
They dosed people, didn't ask to be dosed. Do you know about the CIA?
I didn't know they didn't ask to be dosed.
Oh, my
That was
God, the
last thing
CIA.
Nah.
They would set up brothels and then dose people because what are you going to do? You're not supposed to be in the brothel anyway. Who are you going to complain to? You're going to go to the cops?
It's like a study?
Yeah, just to see, like, we're just going to dose these guys, these Johns, and see what happens.
What happened?
They went crazy. Some of them went crazy. Some of them were just like, what was that? But, like, they're not going to go to the police because they weren't supposed to be in the brothel to begin with. CIA is so sneaky, but, like, a little funny. So I'm like, Y'all always getting up to something. That's why I see why people don't want to get the jab, because they're like,
Yeah. Conspiracy.
is the CIA in on this? And the CIA is like, we didn't have anything to do with this. But like, no, but yeah, it is quite serious, especially if you're predisposed to mental conditions.
Yeah.
You should be wary of psychedelics if you're predisposed to certain mental conditions.
Yeah. I would just say, be on the lookout. That's it.
But mushrooms, I'm like, all right. Do
I would
mushrooms
just the only thing I would be scared of is, again, bad trip leading to certain behavior, which could lead to you getting hurt or hurting other people, stuff like that.
jumping out a window?
Yeah. That's it.
Yeah.
Plus other, like, things that could potentially happen, but mostly that.
Well, also, you see a lot of these cults who use LSD or did use LSD to manipulate their followers.
Mm-hmm.
Om Shinrikyo, Charles Manson. Where Charles Manson got it,
Government.
CIA, we're not even going to question. But
I didn't know that either.
I'm not sure 100% he did, but there's this book called Chaos that's just like, seemed as though Manson and the CIA were real close. There's a lot of stuff not adding up here. And it's like, well, we don't know for a fact, but...
What would the CIA want with Charles Manson?
Okay, so he thought he was going to set off a race war. They wanted, according to the thesis of this book, is they wanted to undermine the anti-war hippie movement.
Okay.
So what better way to do that?
Through the hippies.
Then,
Dose them with LSD?
well, than to have a psychopath. They did the murders. They murdered Sharon Tate.
Yeah.
So he got his followers to murder Sharon Tate. So the conspiracy is that they were trying to undermine the hippie movement. It's not a conspiracy. He has a book. It's called Chaos. It's a very good book. I'm halfway through it now. I'm not going to say that it's a fact that it happened, but I'm also like, I will believe the CIA did anything in the 60s. You couldn't tell me anything. And I was like, oh, the CIA didn't do that. I'm like, of course. I don't put anything past them.
Mm-hmm.
So you have to watch out for that. Now, if you get... I know we can't regulate cults like that because this is a group of people and we have freedom of assembly.
Mm-hmm.
We have, freedom of speech. So we can't regulate cults until they start doing illegal stuff.
Mm-hmm.
But if a cult leader wanted to, he could easily manipulate his people through LSD. It's happened before.
Didn't know that.
Om Shinrikyo?
No, I didn't know that about Charles Manson. But yeah.
Oh, yeah, he was manipulating his people. And that's the other thing about psychedelics is if we're going to start selling them in the store, we got to start teaching all the kids that it's the drug doing it. It's not the person who's giving it to you. Because once you're in that state where all your guards are down, you're suggestible.
It's like being hypnotized. It's
Exactly.
the same thing.
Exactly. So
It makes sense. I didn't know that. That makes a lot of sense.
I don't want to be like spreading rumors. Buy the book Chaos. I'll put it on the screen. People can read it for themselves and decide if they think what happened. But I should be able to buy LSD in the store. But should anybody be able to buy it in the store? And what are they going to do with it?
I don't know. I mean, I can't advocate for that. LSD, I've just personal stories of a couple patients I've seen on LSD. I've seen a little girl take one hit of LSD and then her personality, talking about personality change, completely changed. And she thought that she was a certain star and she was just all like very energetic and not really caring for herself and all this stuff. And it was scary. And you could tell she was scared. And it's like, crap. Like, for her brain wasn't ready to take on that. Or maybe she did too much. So that's what would scare me. And how to regulate it, I mean, I don't know. You got to know the dose, like alcohol. You got to know how much it is, the legal limit of it, and all that stuff. You got to set all that up before you legalize a lot of drugs. And it's harder for drugs to know that for every single person.
Yeah. I mean, it's just one of the things. Well, trial and error, right? We'll see.
Exactly. So I don't know. That's why I'm weary of the organization behind it, how you regulate it, how you dose it, and who can take it and what age.
I mean, we're in America and we have freedom. So if some guy wants to buy a vial and give it to all of his friends and then tell all of his friends that he's Jesus while they're under and he's not under, and he wants to play a guitar and make a song, that's all within the law. If they legalize it, And
definitely if they legalize it, like, if something were to happen and you're under the influence, like, there's a defense where you try to say like I was under the influence and I didn't know what I was doing. But no, because now you know that this is a drug. Here are the effects, informed consent. You chose to do this. Sorry, like you don't get that defense. So a lot of those things will go away. But potentially you could have a lot more impulsive acts, aggressive acts that society reacts negatively to, leading to arrests, leading to hospitalizations and stuff like that. So I don't know.
I'm still pro legalization. I just wanted to
I
ask.
am too.
That's good.
I'm too.
One question about that girl who took the LSD. Was she high under the LSD when she thought she was a superstar?
Yeah, but then it stayed.
It stayed
away.
after.
Yeah, it didn't go away.
Still now?
I don't know. This was a long time ago. So it was when I was in a different inpatient place. And I was just covering. And then just reading up on her history and all this stuff. Perfectly fine. Did this. It's been a couple weeks and still like this. And then when I'm seeing her today, still like this. And it's had an adequate time for the drug to get out of her system. And it just sucks. So now it's like this disorder that you're exhibiting as based on this is now here to stay. So now we're treating the disorder less the drug use. Of course, when they leave, abstinence, all this stuff, here's the risk. But this is the condition you have now. So now I'm treating this.
Wow. That's terrifying. Because people, in high school, they give it to their friends. And
Yeah.
is there a way to test to see if you would be set off negatively by
No,
psychedelics?
because that's why, like, when you, like, some people, like, when you hear, like, yeah, I can't smoke or I can't use this part because I'm paranoid or I can't do this because I, like, start seeing or hearing things. And that just is a trigger in my head, like, okay, you're one of those individuals that are more susceptible. So if you were to do this, this is how you should do it, or you should avoid it at all costs. If you feel like you have to do it, cut down the amount, obviously, but that's when you would know. So that's why it's hard, because there's always a risk with everything. Like alcohol is a risk, and it's legal. Nicotine's a risk, it's legal. Weed's legal, kind of now. And then, so the other things, I think I'm all for legalizing it. Here's the set of rules. Let's tax the shit out of it. I'm fine with that.
Oh, people are not paying attention to any of the
Yeah.
marijuana taxes. You know that the
Ridiculous.
legal weed is all dry. No
Yeah.
one wants to smoke that stuff. It's all dry and in little baggies. No. Everyone wants a
The
black
bag
market
looks nice,
weed.
though. It's a
Nah,
nice looking bag.
it's dry.
You get
'Cause
a free
it-
lighter and free little chocolate
you
with
get
it,
that.
whatever.
You get that at the black marketplace too. The black marketplace has the dank weed. We know that. Anyway, don't listen to any
I
of
don't know
this
what
for
you're talking
advice.
Yeah, drugs are bad.
Drugs-
Dare to be different.
Dare to be there. That's. Well, I hope they learned from the way they legalized marijuana. Don't do it that way, because they screwed up the legalization of marijuana in California
Yeah.
pretty badly. So that now they've made a bigger black market, because everyone still gets it, black market.
Mm-hmm. Yeah.
And then the regular stores, the legal stores, are like, "Where are you getting a black market?" I'm like, "I'm not gonna tell you." Why? So you can go to cops and shut them down?
Exactly.
Like,
Yeah. Busting up these drug farms.
I know that you have a baby and you need to get back to her, but can I just ask you? The audience had some questions,
Yes, of course.
so I just wanted to ask you some audience questions.
Let's do it.
Okay. Michael Lopes asks, "Is the shaman delusional?"
I would. Again, situational. I would see what the shaman is talking about. If it's something where clearly it's not, when I say clearly it's not true, something that's been established in our society as true universally, and you're just going against it, and we know that it's true, like, I would say no. But as far as like, I don't know. I cannot answer that question because I don't know it. I don't know specifically, and I don't know if someone identifies as a shaman, if they have like universal, the same beliefs, even with that title. I don't know. So it's very person dependent. I look at all the factors. I look at how they were when they were a kid, how they were growing up. Is this beliefs they still shared? Is this something backed up with facts or something fixed? Because even the definition of delusion, fixed false belief, but I don't know. I think it kind of like fits into religion. It's just that might be your way of your belief system. This is how you get through the day. This is how you explain your truths and your reality. So not really saying it's delusional. The only time I would really say something is a delusion is if they're wholeheartedly fixed in something and it's causing a negative effect. That's when I would come in and say, okay, yeah, you believe this such and such, but you have all these infections now because you're choosing to believe this and you're refusing this specific treatment, which we know works for this, and you're just this.
So holistic medicine is delusional?
No, not holistic, but like certain type of treatment that maybe even holistic medicine would work or allopathic Western medicine would work, but you're choosing not to do either. You're choosing to have this belief, or I'm going to say this instead of getting chemo. I'm going to do this instead of eating a certain diet, which would decrease my antioxidants and things like that, on free radicals and things leading to cellular destruction, like holistic medicine can work with. If you're choosing not to do either one of those and you just have this specific belief system with no kind of science or no kind of evidence behind it, then I would say it's delusional. But if you have a certain belief system and it works, really can't say it is. Mm-hmm. So I said very long answer, very long-winded answer, but the answer is I don't know. Depends on the person. I have to see the person, their belief system, what they truly believe, what they've been doing with that belief, and then I can say yes or no.
Okay. Chevy God asks, so religious people catching the Holy Ghost, crazy or nah?
I would say no, because in that belief system, that is an acceptable practice. Just because maybe if you believed it and it never happened to you doesn't mean it's not true, or maybe they're not feeling it. They just might be overcome with emotion, and that's how they're showing it. As far as catching the Holy Ghost and speaking in tongues, things like that, speaking in tongues is something I believe in. I think that it is something that is true, and it's really applicable to certain religious sects, where they speak in tongues more than others. But again, that could be overcome with emotion. It could be someone who is trying to manipulate other people and saying that they're doing it. So it could be a malicious thing behind it, or it could be something organic. I believe in it. I believe that is something that's true. But again, I'm not. If you're coming from a different perspective and you're saying, well, where's your evidence? Where's your evidence of God? Where's your evidence of this? And you have an argument thinking that it's a delusion and all the practices with it are a delusion. That's your belief. That's what you can do. So I can't really speak to that. So I think it is. For me, it is.
When they speak in tongues, there's no syntax or anything. It's not like they're just...
Yeah.
They're like babbling?
It's almost like it's like you're letting the emotion of the spirit, I'm going to just use my religion, spirit of God, just like take over your faculties, take over the way you move, the way you speak. And it's just like everything hits you at once. It's kind of like if you and Tony are going somewhere, and then all of a sudden he surprises the hell out of you, and you just have like all this emotion. You just don't know how to speak. You don't know what to say. Same thing, like just overcome with emotion, and then this is a result of it. So I think it's common practice in religion, overcome with emotion, combine those two things, and this is you going through it. This is, could be a learned behavior. Could be something you've seen and you just go through it, or it could be something you just feel and you go through it.
Yeah.
But I can see someone outside who doesn't believe those things saying, oh, it's a delusion, and I don't have an argument against them. This is just what I believe, and this is just, and it's cool.
So what is a delusion?
So a delusion is just a fixed false belief, and then when you present evidence against it, you still believe it. Even though there's evidence contrary to it, and you still believe it. And there's different types of delusions. So there's grandiose, where you feel like you have certain abilities or you're in a certain status higher than what you're objectively showing. Like, I'm the president of the U.S. and I have billions of dollars in the bank, but you're homeless, stuff like that. There's somatic, where you have like your five senses delusions. Like I have this delusion that I feel like spiders crawling on my arm, which you can have with chronic alcohol or cocaine withdrawals, things like that. You can have jealous, where you believe someone is your spouse is cheating on you and you have no objective evidence, but you just have these beliefs and you read in every little thing. The most common one is persecutory. So feeling people are after you, trying to harm you, trying to hurt you, people are listening in on you, and then the resultant behavior from that belief. And then combine, where you have combinations of them.
That last one you mentioned, I think a lot of people are suffering from that now.
Yeah.
Just because of the media.
That, and the thing is, like, we're not really helping dispel that, because there are people watching us on their phones. There are people listening to us. So it's like, it's not a lie.
Yeah.
So that's how I would answer the religious question. Like it's not really a delusion, but kind of is. But it just depends on your perspective and what's specifically applicable to your situation in that moment, causing a specific behavior. Then I would say I have to look in your world and say, what is your world? How are you reacting to things in this world? Is it causing negative effects to you emotionally, psychiatrically, physically? Let me address that to get you back comfortable in your world, so now you're able to integrate into our world without issue. So
you said somatic is when you feel?
Yeah, somatic is just any type of sensory thing. So like it's mostly tactile.
So when they catch the Holy Ghost and they fall back, do you think they feel like they caught the Holy Ghost? Do you think that's a somatic delusion?
I don't know. I just think it's overcoming emotion. I don't really think it's a somatic delusion.
What about that guy that flipped his jacket and all these people fell back?
That is a psychopath.
That man was a psychopath?
I think so. Because he's trying to get a certain thing.
But the people who felt it.
Yeah.
And then they fell back.
Could be suggestible.
Yeah.
I have this power. I have this grandiose belief, and I'm using it for this. Here, I want you to buy this bottle of holy water, $20. We'll mail it to you. Here's a towel that I anointed. Here's like
That's
a lot of
good price for holy
televangelists
water.
have like that type of play. And in my opinion, when you're selling things like that, I think that's the people trying to make money. But as far as like the gospel that they're teaching, I don't think that's delusional.
No.
As far as other things and like associated with it, you're just using the religion for personal gain. You're using this established thing that to that group of people, there's evidence of it, but you're using it for your own gain. So it's like a combination of both.
And that gets back to the discussion we had earlier on the last podcast of how psychopathy is just standard in our society because it's just a hustler.
100%. Yeah. And I think the numbers are a lot higher than what we think.
They're going to be for this next generation if they don't talk to people, that's for sure.
Oh, 100%. I'm here for me. I don't care about you. I'm going to do what I got to do to get ahead because life sucks. So I got to make it better somehow for me. I might not be here tomorrow. So let me make more impulsive decisions. Let me focus on me and not you. I don't even know how to talk to you unless it's with emojis. So it's a lot of stuff.
That's really interesting. Do you have 5 minutes left? Okay. The last thing I'll say, and so we've ended this on religious people are not delusional, but people who exploit them are psychopaths.
Yes, I believe, yes.
Yeah. Although you probably couldn't put them in an institution if you wanted. Even if you wanted, there's nothing you could do to them.
No.
You couldn't be like, yo, this guy's a psychopath and do anything, or they're just going to be like...
if they break laws, you can put them in jail. That's about it. But besides, that's the way our society works. Like, we should be treating these individuals, but the way our society is, they're too far gone. They're too organized. They're too set in their personality, set in their ways, that it's going to be hard to change. That's why when we talk about, like, antisocial personality disorder, the prognosis is worse the later you catch it. You really have to catch a kid early in it before they become, like, enmeshed with the traits of this disorder, because then it's impossible to change them.
That's so interesting. Last thing I'm going to ask you about, do you have an opinion on Simone Biles?
Yes. I had an extensive discussion with one of my friends, group chat, and I actually won an argument. And I actually won the argument between me and the friend. I 100% applaud what she's doing. I love it. Specifically with her situation, I don't know what the hell she's been through. I could never do what she does. She's already demonstrated she's the GOAT. She wants to take a break. She could take a break. I don't care when it happened. You can already tell because she said I've been subjugated to people's opinions of me, and this is my identity. So when Olympics come around, I have to take part of it. I have to listen to these people I'm trying to impress. So yes, it would have been better if she quit before, but that's easier. I think it's a sign of strength that she quit right then and there because she moved forward with it based on possibly the suggestibility of other people just to push through. And then she's like, no, I could die doing this if I'm not 100% here. So I'm quitting now. I think it's a sign of strength. I applaud her. And I'm glad people are talking about mental illness and finally putting it to the forefront. So I loved it.
I didn't love it or hate it. I just thought it's like, okay, she needed a moment, so we shouldn't celebrate it or criticize. We'll just be like, okay, we have a whole
Yeah.
team.
Yeah.
Because, I mean, I don't know if she was looking to be celebrated. You know, she was just
No.
looking to be like, I can't do this next vault. Because if you see the vault that she did, it seems as though, like she said she got lost in the air, which
Yeah.
means like she can't trust her body. So if
Yeah.
she can't trust her body, and she said in the nationals or the trials that her body does it. She could do it a million times. She doesn't have to think about it. Her body's just going to go up and do it. And then if it didn't, she's like, I can't trust my body.
Exactly. And who knows, like, this could be just a function of Tokyo and not having that support out there. I mean, there's always a stadium people cheering her on. Maybe that's the motivation she needs. I don't know. I don't know anything about her. Again, this is her. But maybe that helps kind of drown out her own mindset and to do those things. And now you're just here. This is the first Olympics for her, I believe, like this, right?
For anybody.
For anybody. So it's possible. I'm not trying to speculate or anything, but who knows? There's other factors that we don't know. This is her. She's proved her greatness. I'm glad with her doing what she did.
Yeah.
Maybe my personal opinion is like, man, why would you do that? Blah, 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 blah. We're putting ourselves in that situation, not knowing what she's subjugated to, not knowing what she's going through. We're putting our own experiences through that. I think that's unfair to her.
Yeah. I think Tim Dillon said a funny thing. He was like, these Olympic athletes don't represent us. We're fat. We're drunk. We're not Olympic athletes. We
The
just
real person Olympic?
Yeah.
That'd be great. Oh, my God. The average height, average weight of, like, the people in your country, and that's who represent you? That'd be
It's
awesome.
impossible. Maybe for, like,
Average
what sport?
intelligence.
Curling. Anyone can do curling.
I can't skate, though. I'd fall. I'd
Are
bust
they
my
even,
ass.
are they even
Oh,
in
no,
skates?
they're on shoes. They're on
Yeah.
shoes. I'd bust my ass.
On shoes?
On ice?
I've never been on shoes on the ice.
I'm sure it's like, wouldn't it be ridiculously slippery if you're moving backwards trying to...
Maybe they have special shoes. I know I'd rather be on the ice on skates than shoes any day of the week.
Okay.
I'm like, why are you doing this? But then they'll clear the rink for curling competitions. I'm like,
Yeah. It's so bad.
what are y'all doing? You know why I can't respect a sport you can do after 6 beers? Like 3 beers or whatever. But if you and your friends have slammed a 30 rack and you are still performing that sport,
Mm-hmm.
I don't respect your sport.
Yeah, I can see your point.
This is not applied to Simone Biles because I think gymnastics is probably the most difficult sport and the least margin for error.
Yeah.
Absolutely no margin for error, especially what she's doing. If anything, if she were gonna go do it, which it's already said and done, and she pulled out of the all around,
Mm-hmm.
and an American still got the all around medal, so no harm done anyway. But a lot of times they'll just make things easier. But if her body's trained for this vault, it'd be harder to even change the vault last minute.
Yeah.
You just mess up the vault you planned, and then not everyone can just last minute change
Exactly.
the move.
And I'm not fully aware, but this is the first time ever doing this specifically, right? Mid-match. I think she's had hesitancy before, but not like mid-match.
I've never seen anyone pull out mid-match.
Excuse me.
At the Olympics,
Yeah.
I've never seen anyone pull out.
Yeah. So, it's new, but I'm 2021.
Yeah, if she says she has to pull out, she has to pull out.
Yeah.
We're not going to do that vault.
Exactly. Get your ass up in there and do it. That's all I would say. Get your ass up here and do what I do.
I won't even do a
can't do it?
single
Shut up.
vault. Yeah. Have you tried? Have you ever
Nope.
gone onto it? No,
I know I can't do it.
I can't.
I applaud everyone that can. I'm in awe of everyone who can. I'm just like, you made your body go that way? That's crazy.
Even doing a 1 flip vault, no, I can't do it.
can do a
I look at
cartwheel.
the thing. Okay.
My cartwheels are trash.
So yeah, the impulse that night, everybody was judging her. Everyone was saying terrible things about Simone.
Mm-hmm.
Like, you've let the country down. You've let this, and that down. Like, calm down. We're coming out of a Trump presidency. Like,
Exactly. We have other big things to think about still.
well, the country's been let down a million times.
Stupid.
What did your friend say on the text? What were they saying about Simone?
Oh, just basically, not like, it was kind of like the mid-match thing they found upsetting. Like, I get all that, but why do it mid-match? And then part of it was like, you make a lot of money, that thing, other people have bigger problems and this is your problem. And, so on and so forth. The main point of contention was when it was done.
Mid-match. Yeah.
So I was like, I can't answer that. But again, I'm not her. She's done it, and she's excelled in it to the best ever. So I'm trusting her.
And she pulled out of the all-around. It wasn't like she was like, oh, this is all about me and I'll get mine. She pulled out of the all-around.
Yeah.
She knew whatever was happening. And I don't know. When I first saw it, I was like, did she get like temporary vertigo? Is that possible?
Possibly, yeah. You can mess with like the stones in your ear canal otoliths, and they can mess up your balance and your proprioception. If you don't have that, yeah.
Forget about it.
Exactly. And proprioception is just your ability to like attach things in space. Like, I know how far I need to reach to get this pen, like stuff like that. So if you can't do that, you're done.
Yeah. I'm not saying that's what it was at all, but when I first saw it, I was like, oh, that seems like, well, like I said, she's just, her body wasn't cooperating. It wasn't on the same page.
Yeah. I wish her the best. I hope she's okay, and yeah. I'm just glad the conversation's happening, because these are conversations we need to have. I was expecting the other side, the other side of the argument to say what they said, and I get why they say what they said, but it's all about perspective.
Well, they want to pull up Carrie Strug, who broke her leg in '96 doing a vault.
Yeah.
Which, yeah, she did, and it was a fantastic moment for all of America. It did happen. I'm not going to say that, but it was a much simpler vault, and whether she absolutely needed to do that vault for the point system, or was it coaches saying, you go do that vault? Did she have a choice in doing that vault?
Possibly. I don't know. We don't know.
96 was a different environment. I don't know if she could have said, no, I'm not going to do the vault, or, oh, my leg is broken.
Yeah.
She broke her leg on that vault. I watched it live. I was just like, whew.
Yeah. And who knows? Like, she could still be traumatized from Larry Nassar and like the USA team, gymnastics team, the support team. Like, we don't know how that whole thing changed, if it did change, because apparently she's a huge advocate for the victims of him and feels like they haven't gotten their just due. So it's like that could still be in her head. Like, why am I representing this organization who's so diabolical? And it could be like, what am I doing? I need to stop this. Who knows? And she's saying like, this is why, which I get that argument too. But I don't know.
I don't know if it was.
She has to say.
Maybe she'll say one day.
Well, she doesn't have to say. She could choose to say. But
she doesn't. You know what? She do what she wants.
If she wants to quit, that's fine with me. I want everyone to take care of their mental health, and that's priority, because it can manifest in other ways and a lot worse ways. So.
Are you seeing a spike in mental health problems this year after a year of lockdown?
100%. Depression, anxiety, substance use, domestic violence, all these things are up. All these other conditions are way up. A lot of my colleagues have actually transitioned to telepsych because there's such a high demand for it. And yeah, I think psychiatric issues are going to be in the forefront. So anytime someone talks about it, no matter the situation, I'm all for it, because at least people are addressing it. People are going to therapy. People are starting to take breaks that they need and stuff. So.
Yeah, if people are talking about it after Simone, talking about it more, because I'm sure people on the day-to-day, they get in their car and they can't go to work. Or I have a friend, this is how his agoraphobia came down, but he got in the car, he got to the corner of his house, and he could not go further.
Wow.
So, but this was like 20 years ago when nobody talks about it. But now, if we can talk about it, like, what is that? What do you do if this is happening to you, if you're having a problem like this?
It's going to be a lot worse, because everything comes to our house. Amazon, Uber Eats, Postmates. We don't have to leave the house for anything. So I'm afraid for that person who's not getting diagnosed and is just enabled and doesn't have to leave. And this virus is even better for them.
I think half these people who want to go into lockdown again are secretly agoraphobic.
Possibly.
Because they say things and I'm like, that either you've been scared to the point where you're thinking something that's factually not true, that you can look up at the CDC website and see what is true and what is not, or you just want to stay in the house.
Yeah.
Either one of those could be true. I think. Is anyone doing studies like that right now?
I don't think so, no. They need to be. For agoraphobia specifically, yeah. But other stuff, yeah, depression, anxiety, all that stuff they're doing, but not agoraphobia.
Agoraphobia, I think, is the biggest one that might be coming out, because everybody was already a little bit of agoraphobic before.
Yeah. And then germaphobes and OCPD, obsessive compulsive personality disorder, individuals, that's going to go up. It's understandable.
That's scary stuff.
Yeah.
That's scary. It's a whole different decade we're about to go into.
Yep. Everything's changing. I don't even know. I can't even predict what's gonna happen.
Well, it's like if you're normal like we were when, like 2000, you're
Yeah.
a normal person, that is going to seem strange. You're going to seem like too aggressive and too assertive
Yeah.
to the new world. So what are we going to do with these people who are older than us, who came of age making phone calls and, if you have a problem going and talking to the person, they're going to seem aggressive now.
Yeah, 100%. Yep. It's a lot. Remember in 2000 we were worried about Y2K? Or I wasn't worried.
I wasn't worried.
A lot of people were.
I was like, yeah,
I
they're
was
a
like,
party.
yeah.
The ball's going to drop. I can
Exactly.
stay up to midnight. Like,
Yeah. So some people think about this thing like in that manner, like, oh, whatever. Stupid. You're just trying to keep us in the house. Not going to listen to it. I'm fine. My friend caught it. They just got a cold. So.
I have someone's going to do a study in 10 years. Someone's going to have to write the complete history of it.
Yeah.
Maybe in 20 years, and that's going to be what we see.
Yeah.
We have in the middle of it, how do we know who's right?
No idea. We're trying, but
Even the CDC can't make up its mind. Cannot make up its mind.
yeah, that's a whole nother convo. I think they jumped the gun on a lot of times, a lot of issues. I never would have dropped the mask mandate, to be honest. To say it's okay and no, it's not. No, because only thing you're doing is sowing distrust.
Because first they said, we don't need a mask.
Mhm.
And then they say we need a mask. And then we say don't need a mask. Now they say we need a mask.
Yeah,
A lot of people are just going to be like, you don't know what you're talking about. I'm not going to listen to you for anything.
exactly. That's the main thing. What they could be saying is right based on the data they have, but I wouldn't jump the gun with anything. I would be rather safe than sorry.
Just have a mask.
Yeah,
From jump. Cloth mask from jump. Even if it's just to make people feel at ease, everyone's going to get mad at me in the comment section. But even if it's just to make people feel at ease,
Yeah.
I mean, like last March,
yeah,
if they had just said, put a bandana over your face so you don't get droplets, and then just keep that in place.
until we
Up
figure
until
this
now.
out. Yeah, or have better evidence, better studies, and I don't know.
But the no, yes, yes.
Yeah.
Well, on that note,
All right.
thank you very much, Dr. Donald.
Thank you for having me again. This is fun.
This
I
has
love
been
it.
great. People will love you. They've been begging for you, more
It's not because
Dr.
of you. It's
Donald.
not because of me. It's you.
No, they love you. Like, bring him back. I'm like, I'm going to get, he's busy. He's got a baby.
I'll be around. Thank you for having me on the show, and this is amazing. Thank you for, offering your insight to a lot of people who share the same beliefs or don't share the same beliefs, and having open conversations. So this is what's needed. So thank you.
Thank you, Dr. Donald.
Yeah.
All right. Bye, everybody.
Peace out.